that's a little bit off. What about oh, hang on a sec. Okay, Shaira. Shaira says that's a little bit off topic actually. You can't correlate. Good morning. Okay. Really? Do we correlate the results from the do we really correlate the results? Have you looked at I think that's you're confusing CBC with peripheral blood smears, right? There's a separate form, I guess, or a separate request. Shaira, that is confirmatory or a follow-up test to confirm a result. That is different from the actual test. The peripheral blood smear is a different test, right? Yung maririnig yung PBS sa mga request, tapos away na away siya sa CBC. So that I think Shaira is on point with that one. She's almost there. Okay, what about another person? Give me an idea. Diane Enriquet. Ang haba ng pangalan. Diane Enriquet. Hi. Ayon. Correct. All right. I'm looking for one word. We never use peripheral blood smear to double check the effectivity of a blood of your CBC, right? We use it to confirm what we saw on the flags, but we never use it to correlate the results, right? Because that's a different test altogether, right? So wag niyo kasi last time me and Sir Marco created an exam, and we've noticed that students are confusing certain things in hematology. That's why I started with anemia first, the theoretical version, the theoretical lecture of anemia first, then before we go to actual laboratory testing. Okay ba 'yon? Before kong umpisahan yung lecture ko with lab, we'll start with the lectures of anemia, leukemia, and peripheral blood smear examinations. Okay? Next question ko. What is my next question? My next question for you guys is what is the difference between primary hemostasis and secondary hemostasis? Because you guys are lucky. You will have a lecture. Because ever since I started teaching at CMCC, I've never had the chance to talk about coagulation and coagulation disorders. So this class right now, I'm announcing right now, you guys are lucky because I will be teaching you guys coagulation today if we have the time. Okay? But if not, you'll still get a copy of the lecture. All right? Now, what is the difference between primary and secondary hemostasis? Can anybody answer before we move forward with our discussions? Nobody? Okay, Marion. Mhm. Mhm. Okay, very good. Mhm. Very good. Very good. Very good. Very good. So primary hemostasis, the end product is a platelet plug, while secondary hemostasis, the end product is what? The end product is a stable fibrin clot. Okay? The last stage of hemostasis, of course, some books would call it tertiary hemostasis, is what you call fibrinolysis, which we'll talk about later on today. Hopefully. Fingers crossed. Okay? All right. Now, last question. Do you think, ito na, para sa mga nag-intern, do you think that in the future, we will be replaced by automated analyzers? Yes or no lang yan, and say, and explain why. Alright, bye. Yes. Okay. Yes, very good. Unless somebody develops a hematology focused AI, okay, which is so hard because there's so many algorithms that a certain the parameters of a CBC could present. We will not. That thing could probably take 1,000 years for now. Actually, there was I attended a seminar a couple of weeks ago, by the College of American Pathologists, and they said that it is nearly impossible to replicate the human capacity or the human part of releasing results for hematology analyzers. And I'm speaking only of hematology, okay? Right now there are algorithms for clinical chemistries that do reflex studies. You know what's reflex studies? For example, you have the serum sample here from Krisha Senaris that was extracted today. Okay? Time and date is recorded, blah, blah, blah. And it goes to one machine. It goes to one machine that does the analysis. Okay? For her serum. Or it also centrifuges it. So basically, what the medical technologist or the medical laboratory scientist does is he or she puts Krisha's sample in the conveyor belt, okay? Goes through the conveyor line. That thing gets centrifuged. No human interaction there. After centrifugation, the machine goes through a qualitative analysis of the serum that indicates whether it is lipemic, whether it is jaundiced, or whether it is or icteric rather, or whether it is hemolyzed. There are machines that does that. I've seen it firsthand. I was so surprised that there's a machine that can do that. Okay. After that, it will send it to the machine. Like say for example, Krisha's sample had the critical result. Machines can auto reflex. Machines right now can auto reflex. Like for example, critical result for potassium. Um, Krisha's result, she's suffering from hypokalemia or increase in potassium levels. Krisha's sample will run the routine line, but then the machines will think, oh my gosh, there's a flag. It will rerun the tests, okay? But it will not release the results yet unless Marion, the medical technologist or medical laboratory scientist, looks at the results and, oh yeah, I think the results are congruent with each other. I don't think there's a problem with the result. Release. Di ba? Baklang-bakla yung pagkabasa ni Marion pero hindi gano'n. But theoretical lang yun. I don't know what he does. Pero gano'n, yes. Gano'n. Makikita niyo yung result. Yes. Alright? Anyways, let's start with our discussion with anemia. Is that all? What else am I missing? Oh yeah, I asked the three questions. Y'all answered already. I like the answer for Diane and Bai. I'll want to give. Who else answered? Oh yeah, Marion, you're not included. Why did you answer? I'm sorry, you're not included. You already have a lot of benefits being my moderator. So anyways, let's continue with our discussion. Please add points to Bai and Diane, okay? So Gracie ha, iba ang CBC at peripheral blood smear, okay? Nagets na natin yung difference. Pag nag-request sa CBC, ko-confirm lang natin yung nakita ni machine. It's not studying the morphology, okay? Studying the morphology is a different study. It's a different laboratory test itself, okay? All right. Okay. Let's move on to the first slide. Can we start our lovely presentation? Okay. Wonderful. Hematology lecture that we're going to discuss about anemia. What is our idea of anemia? Basically, anemia is a decrease in which blood cell population? Of course, the RBCs. Can we see if we're correct? Yes, a disease associated with low oxygen carrying capacity. It also includes the parameter of oxygen carrying capacity because that's the main function of RBCs. Hello, right? Through decreased RBC numbers, decreased production, and decreased production rate, and dysfunctional RBCs in general. So there are three things that you need to remember when anemia is involved. Hindi yung mababa ang dugo. Okay? Medical technologist tayo ha. Bye, kinig tayo. Bye ha. Bye. Ganto pagka anemia. Pag sinabi, ay, anemic ako. Kasi may mga naririnig ako diyan nung nag-community kami, my goodness. Paki-check nga yung blood pressure ko, anemic ako. Sir, Iba ang blood pressure. Gusto ko by next time na tinanong ka by ha, pag nagpunta ka, magsasalam ka muna syempre, di ba? Tinuruan talaga ng GMRC. Okay? Alright, so by pagkalapit sa patient, pagkalapit ng patient, sinabi ng patient, BP nga ako, miss. Minsan na pagkakamalan pa nga tayong nurses, di ba? Paki BP nga ako, feeling ko anemic ako. Sabihin nyo, sir, maganto po, English na English pa. Gusto ko in English mo pa gagawin, by ha. Sir, pag sinabi nyo pong anemic, your problem is the oxygen carrying capacities of your the oxygen carrying capacity of your RBCs, because there is a decrease in number, decrease in RBC production, or dysfunctional RBCs in general. It doesn't mean that your blood pressure is correlative with your BP. Okay? So ganon, all right? So we want to remove that stigma of us being nurses, as well as being what? As well as the falsehood of the knowledge of anemia. Okay? So clear tayo dun. There's three things that I want you guys to underline those three things: decrease in number, decrease in RBC production, or the rate of RBC, the dysfunction in RBCs in general. Okay? Clear? All right, let's move on to our first index. Okay? The first index that we're going to talk about is related to the size. It's used for anemia, okay? What RBC index is often used to classify anemia based on size? It is MCV, okay? Mean corpuscular volume, okay? Mean corpuscular volume. Now, volume, it means it measures the amount of the average RBCs, the amount of volume or amount of hemoglobin in the amount of the size rather of the RBCs that passes through the analyzer, okay? That passes through the analyzer. All right? Let's move on to the next slide. Okay? What are the classifications of anemia based on size? There are three classifications of anemia. So we have microcytic anemia, normocytic anemia, macrocytic anemia. How do we differentiate them? By sizes again. Now its size is based on liters, the amount of cell in the system, the amount of contents in the system, okay, or in the RBC cell in general. Okay, less than 80 femtoliters is microcytic. 81 to 99 femtoliters, normocytic. Okay, macrocytic is greater than 100 femtoliters. Okay, clear? I want you guys to put a star on this one. I want you to write it on your notes. I want you to write it in your post-it notes. Put it in your I want you to place the post-it notes in front of you whilst you're taking a pee or taking a poop, because this is something that will be very important in the exam. Siguro dito pa lang makakakuha ka na ng 5 points sa exam mo. Sa exam mo. Okay? Understanding knowledge about this particular slide. I cannot stress the importance of this particular slide enough. Okay? Because last year when I had a discussion with my students, same class with you guys, same people, they still are confused with microcytic, normocytic, and macrocytic anemia. Okay? Micro, small. Normal, macro, large. All you need to remember is the numbers associated with it. Okay? The normal sizes. Now let's move on to the next one. The next one is the examples of microcytic anemias. Of course, I'm going to some of the anemias they overlap with each other. You could see certain normocytes in several microcytic anemias, but essentially you'll see microcytic anemias, or the decreased corpuscular volume or mean corpuscular volume in the following cases. Okay, in your exams. Okay, iron deficiency anemia, sideroblastic anemia, and thalassemia. And I want to stress the difference between the three. Okay, let's go to the next slide. Iron deficiency anemia is basically you're anemic because of your diet, okay, or you're losing blood. Say for example, Diane, Diane is somebody who isn't eating a lot of her greens, right? She's not eating those ang arte spinach, 'di ba? May spinach ba sa Pilipinas? Hindi ko alam kung anong Tagalog ng spinach, Dayan eh. Basta you're not eating your spinach, ampalaya, what else? What else is there? What foods are rich? Anything that's green actually. I remember when I was studying nutrition, um the anything with green, anything that with green on it has iron. Okay, majority of the time it has iron. I'm not really sure specifically, but yeah, she's not getting her dietary intake. Now, and then the difference between her and Gracie is because Gracie got stabbed. Okay, nagpunta siya sa Muñoz Market, and then merong nag-amok doon. Sinaksak siya, 'di ba? Bababa yung blood cell count, which also includes which also includes what? The dietary fiber, 'di ba? Yun lang yung pinagkaiba niya. So could you get iron deficiency anemia from blood loss? Yes, right? There are certain parasites that can cause what? Microcytic anemia, 'di ba? Can you give me a parasite that can cause microcytic anemia, microcytic hypochromic anemia? Can you give me a parasite who when infected who that when infected when it's on the infective stage, or rather in its adult stages in the human body, can cause microcytic hypochromic anemia. Take note, I'm overlapping with parasitology right now because in my questions, you might see bacteriology questions, especially in hematology. Hematology is a very broad subject, okay? We'd see parasitology questions thrown in there. We'll see bacteriology questions thrown in there. Now I want to know if people still remember their parasitology. Which parasite causes macrocytic hypochromic anemia? Renmar. Yes, girl, alam mo yan. Okay? So it causes microcytic hypochromic anemia. Very good. Why? Because it feeds on blood cells and it attaches to where? It attaches to the small or large intestine, Renmar. Patay na. Patay na. Large ba, class? Kayo talaga ha. Who knows where the attachment, before tayo mag-move on sa next who here is sure that the organism is really in the adult stages of the hookworm stays in what part of the body? Okay. Patay tayo dyan. Ako, maglalagay nga ako ng mga parasitology question na related sa hema. Patay tayo dyan. Sige, for one point. Sige. Leila. Oh, okay. Very good. The intestinal walls. Okay? So, tandaan mo, large intestine. Iba yun sa large intestine, Renmar. Renmar. Leila, it's my first time seeing your wonderful face. Thank you so much. Please add 1 point to Leila. Okay? Okay. Now, let's move on to our next topic. Sorry, not next slide. Okay? No. Wait lang. Chill lang tayo. Doon na tayo. Yan, ayan. Alright, so sideroblastic anemia, there's a dysfunction in the heme production. We'll talk about that later, okay? Thalassemia, we've already discussed it last time, right? With the hemoglobin disorder, it's a quantitative hemoglobin disorder where the coding for either the alpha and globin chains is dysfunctional. Okay, so there's a genetic anomaly there. Okay, so thalassemia, sideroblastic anemia, and iron deficiency anemia. All right, let's move on to the next one. Okay, I think it's trivia time. This is the most common cause of anemia. You will be asked this question really when I was taking my board exam. One of the questions that appeared in my board exam is an epidemiology question. And this is a type of an epidemiology question. Note that throughout our discussion, I will refer to certain epidemiological cases as such. Okay, the most common, blah blah blah. I won't ask for numbers because that's something that they don't ask in the exams. What you need to know is what is the most common. Like for example, what's the most common cause of UTI? It's Escherichia coli. In this case, in hematology, this is something that you need to know. If you don't know this, you better know it. Okay, you better remember it. Okay. Who can answer that one? Kim Kylie Dominguez. Yes, okay. Ganito lang ang ano natin diyan. Ganito lang ang thinking natin diyan. Maraming mahirap sa mundo kaysa sa mayaman, 'di ba? Not all of them get the right amount of food, or not all of them get the proper nutrition that a person should get, right? So, the most common cause by way of logic is iron deficiency anemia. Bakit? Go back tayo dun sa tatlo. Go back tayo dun sa tatlo. Sa tingin nyo, 1 out of 1,000, or out of the 69 of us, okay, out of the 69 people here, 69 ba yung tao? Parang 69 yung nakita ko kanina eh. How many do you think, in this class, how many do you think are suffering from sideroblastic anemia? Maybe one of them, we don't know, because we don't know yet, because not everybody goes through rigorous studies. Maybe one, okay? Thalassemia, maybe zero, because thalassemia is, unless you're part Mediterranean, okay, or you're either Greek, Roman, or Greek or Italian, you're or somewhere in the Middle East, you wouldn't get thalassemia. Okay, so by way of think, by you, I want you guys to think. I'm not teaching you the theories. Okay, we're done with that. You come into this class with the assumption that you've been exposed to this information already. I want you guys to practice your test taking skills. That's the reason why I'm here. I'm not here to go, oh, this is the coding for that one and blah 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 blah. No, we're here to answer your question. We're here to answer questions that are relevant to what you will be taking in your exams. Okay? So I want you guys to think about that. Okay? So iron deficiency anemia is correct. Thank you, Kim Kylie. Okay? So by way of hindi ko ba alala sinabi ni sir. Tandaan mo lang madaming mahirap sa Pilipinas. Okay? Maraming mahirap sa Pilipinas. Therefore, konti ang nutrisyon. Okay? Pag konti ang nutrisyon, hindi nakakakain ng spinach. Isa na doon si Dayan. Okay? Isa na doon si Dayan. Hindi niya kasi alam yung Tagalog ng spinach. Nagpunta siya ng palengke. Syempre si Mother Tindera, hindi din niya alam kung ano ang Tagalog ng spinach. Nagtinginan sila. Ano ang spinach? Wala na, nagano na lang siya. Bumili na lang siya sa karinderya ng ng crispy pata. Unhealthy na yung diet ni Dayan. Di ba, Dayan? Alright. Okay. Siyempre, nag-nosebleed na ang tindera eh. But anyways, let's go to the next one. I think I didn't answer that. I didn't add the answer to that question because, girl, we already know that, right? Okay, so we go to the next one. Okay, most common form of anemia encountered in the clinical lab is iron deficiency anemia. So basically, it answers the same thing. Okay, iron deficiency anemia. Okay, now let's talk about iron deficiency anemia as a whole. Okay, specifically. Now, iron deficiency anemia, there are two things that you need to remember. Okay, when you're studying for your boards, you need to remember the chemistry of it. Okay, let's go down. Oh, don't worry, you're doing fine. Marion. Chill ka lang. Medyo hyperactive ka ngayon, Marion. Alright, pagod na, Marion. Pagod na, Maya, pagod ka na. Okay, alright. So there are two things that you need to remember, okay? The chemistry results of this patient and the blood film. So hindi naman kami doktor, bakit namin kailangan alamin? Okay, mag-alala, tinatanong sa board exam yan, okay? Hindi ko, alam ko wala tayong pakialam dyan, pero itinatanong sa board exam eh. Hindi man itanong dito sa atin sa hematology, itatanong sa clinical chemistry. So what are we going to look for? So for clinical chemistry, you need to remember ferritin levels and transferrin levels. You need to remember for hematology, the blood film morphology. So when the doctor requests for a blood film, they're going to see microcytic hypochromic anemia. Now for chemistry, huwag niyong kakalimutan, low ferritin and high transferrin. Kahit yan lang yung tandaan nyo. Okay? Kahit yan lang yung tandaan nyo kasi dalawa lang sila na pinagdi-differentiate ng mga examiners sa board exam. Kahit yan lang yung tandaan nyo. Yung isa is sideroblastic anemia. Tingnan ninyo mamaya. Okay? Okay, pakitain mo na. Moyo. Tingnan mo nga, tama ba ang sagot ko? Tama, okay? Clinical chemistry results that you're going to look for is low ferritin, high transferrin. The blood film that you need to be aware of, or the blood film morphology that you need to be aware of. Or we call it here in, I think in Saudi Arabia and here in the United States, they call it the blood picture. Okay? When I say blood picture, okay, after this slide, you need to remember it's the morphology, okay? What is seen in the blood film na lang, okay? Kasi outdated na pag sinabing blood film, okay? Let's go with with the blood picture. So you'll see a blood picture of microcytic hypochromic anemic RBCs. Okay? All right, clear? So when you see it in a case study, patient came into the ED with acute blood loss anemia because of a stab wound. Here are the following results. Low ferritin, high transferrin. So it'll give you normal values on the top with open and close parentheses. Okay, you'll decide, oh, low ferritin, high transferrin. Okay, and then it gives you the picture of microcytic hypochromic anemic cells. All right, select which of the following best suits the patient's result. Yun yung mga ano, sideroblastic anemia. Is it sideroblastic anemia? Is B, iron deficiency anemia. D, thalassemia. C, hemoglobin, sickle cell disease. Ba? So, obviously, you already have it could be a long question. It could be so long. It could be such a long question that you'd be given the whole story of the patient. But all you need to remember, if you see low ferritin, high transferrin, and the blood film shows microcytic hypochromic anemia, know that it is iron deficiency anemia. Okay? Clear? 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 All right. Next slide, please. Okay. So, because we talked about ferritin and transferrin, I think it's important that you guys need to remember the storage form of iron, because there is going to be there's also, when we go to cytochemical stains, I want you guys to remember the difference between ferritin and transferrin also. So iron is stored as what? This is comes in the storage form as what? Ferritin or transferrin? Let's go with type keyboard warriors. Okay, keyboard warriors, type your answers in the, is it transferrin? Okay. Okay. Or is it ferritin? Alright. Active ang class ngayon kasi bumula ang bungangan ni Sir Marco. Gusto ko yan. Gusto ko yan. Active ang class mo ngayon, Sir Marco. Huwag ka kasing nang i-stress. Huwag nyo kasing ini-stress si Sir Marco. Alright. Okay, so apparently everybody answered correctly. Let's show them the answer, Moyo. Alright, ferritin. Okay, now let's move on to the next part of our discussion, which is transferrin. Transferrin is, of course, the transport form, or the transported version of iron in the human body. Okay, and in the clinical laboratory, it is measured using what? Using what assay? What assay do we use? Mga nag-intern. Are you familiar with TIBC? No? Okay, can we see the answer mo? It's total iron binding capacity. Okay, so transferrin can't be measured directly, right? We measure the total iron binding capacity. Okay, all right. There's an assay for that one. I'm not gonna discuss that for so long, because that is a topic that is for clinical chemistry. Okay, they have a lot of questions also for clinical chemistry. That heavy metals. Okay, just go if you want to know more about that one. There is a lecture for that. There is a discussion about that one. But to move on with the pace of our discussion, we're gonna leave it at that. Okay, so we don't measure the transferrin directly. We measure it using the total iron binding capacity. Okay. Okay, now, nice to know question. Let's go to the next one. I think that's a nice to know question. A triad of clinical findings associated with IDA. I think we've already said. I think that is known as Plummer-Vinson syndrome. Okay, you might see it if you're going to proceed with medicine. A lot of students know about it. It's esophageal webs, IDA, and dysphagia. Okay, dysphagia. What does dysphagia mean? Who knows what dysphagia mean? Mabilis na mga Google warriors naman tayo. Who knows what dysphagia mean? Walang sasagot. Walang gusto may points mo. Yung walang may gusto ng points ngayon. Oh, by the way, Andrea, go. Andrea. Very good. Okay, dysphagia. All right, that's dysphagia. Okay, so Plummer-Vinson syndrome is associated with IDA. Okay, it's a clinical set of disease, a triad of symptoms that eventually is called that is known as Plummer-Vinson syndrome. Okay, what's esophageal webs? Esophageal webs yung parang nagkakaroon ka ng varicose veins sa esophagus mo. So when they do a um, visualization studies, you go to it's not colonoscopy. The colonoscopy goes the other way. I can't remember. Endoscopy. Yeah, endoscopy. The colonoscopy goes the other way around. So when they send you to endoscopy, they'll see esophageal webs. So it's like varicose veins um, in your esophageal wall. Okay. Now let's talk about the next one. I think we're going to talk about sideroblastic anemia. Okay. Now, sideroblastic anemia, we need to know the etiology first, right? Is that the first one? Monyo, can you see? Okay. So, what is the etiology of what do you mean by etiology? The cause, okay? All right. So, in sideroblastic anemia, there's a problem with the production of heme, okay? The problem here is heme. All right. And what is the pathway that is affected? Is it the globin chain pathway or the heme pathway? Of course, the heme pathway. The problem there is the heme pathway, specifically the porphyrin pathway. Okay? Are you familiar with the heme pathway? Who here? I think somebody owns a. I don't know if they still sell that book. Very popular when I was still it's a very popular book when I was still a student. They have a mnemonic for that one. Sino dito yung merong libro na may mga picture ng elepante? Wala na. Wala na kayong libro noon. Yun yung pinaka-important na libro. Alam niyo ba nakapasa ako ng board exam dahil doon? Hindi ako bumili ng Henry. Yun lang ang ginamit ko. Yung mga may questions nung ano, kalimutan ko yung tawag doon. I'll ask Sir Marco later what that book is called. It's a clinical laboratory approach. The title is Clinical Laboratory Approach. I forgot the author, but says that it gave the mnemonic of we'll see abnormality in the heme production pathway. So there is a mnemonic for that one. I'll show you in the upcoming slides. Let's go with the next one. So the porphyrin pathway is the abnormality. Okay, the enzyme that is often inhibited in patients with sideroblastic anemia, meaning that it is a genetic disorder, is the aminolevulinic acid synthase assay or the ALA synthase. Okay? ALA synthase deficiency. It's an ALA synthase deficiency. There's a problem with the DNA, okay, with the genetic coding rather, that codes for aminolevulinic synthase acid. What is the function of that one? Well, basically, it is responsible in the what? It is responsible in the porphyrin pathway. Okay? So, it's important in the porphyrin pathway. So, ano ba yung porphyrin pathway na yan, sir? Ano ba yung pinagsasabi mo na yan na porphyrin pathway? What disease is also known as vampire disease? Are you guys familiar with that one? Last week, we've discussed that one. Naku, nakalimutan na nila. Hello? Walang nakaalala. Disease that's also known as vampire disease. Kim Angelica. Porphyria. Why do you call it vampire disease? Allergy to light. Yes, but it's not really an allergy to light. Right. Well, commonly, yes, that was considered that was the because they don't have when the time that they discovered this disease, they thought it was just allergy to light. They didn't know. Okay, that was at the time when they were studying their advancements in quantum physics were being unraveled, and they knew that light are composed of particles. They thought that the particles were causing an allergic reaction because it presented as such, All right. So that's the reason why it's called as vampire disease. Okay. Okay. So pathway tayo, mnemonics time tayo. Hindi pala kasama diyan yung ano, mnemonic na gusto kong ibigay sa inyo. Okay? Pour your cup ano ba 'yun? Pour your cup a protopore part. Oh my gosh, I lost it. I have it here already. Okay? All right. So, the pathway is as follows. Wait. I lost it. I copied it from somebody already. I want you guys to remember this. Let me just take a picture of it and I'll share it to you guys. Because I like the way they presented it like this. Now, do we need to remember this, sir? I don't think so, but the fact that you know what porphyria is means that you have an edge over students who don't. Okay? All right. Let me hang on a sec. Let me present. Pa-join naman ako ha, please. Pag nakita nyo nagjo-join, magjo-join ako ha. Okay. Okay. Can you guys see me? Pa-join naman. Pa-join naman sa GC. Okay. You join the meeting when someone lets you join in. Who here can um I want to show the picture. It's on my laptop. Hindi ako maka-join. I so mean. Okay. Oops. Ayan. Okay, naka-join na ako. Okay. Thank you kung sino man yung nagpapasok sa akin. Alright. So, I'll replace your presentation, Moya, for a while. Okay. Thank you. And I'll show you the picture that I took earlier. Where's the picture? Okay. So, this is the pathway. Okay? That's the pathway that you are going to remember. You're not going to remember that one. What you guys need to remember is where sideroblastic anemia, lead poisoning, and porphyria cutaneous tarda happens. Okay? Which parts? Okay? So, problem with sideroblastic anemia is ALA synthase. We already discussed that. Okay? That's the first one, from glycine to succinyl carboxylate. Okay? And then of course with the help of vitamin B6, okay? With the help of vitamin B6 and 8S-ala dehydrase, you'll get porphobilinogen. Okay? Porphobilinogen. Oh wait, first we start with the help ALA synthase, glycine succinyl becomes aminolevulinic acid, or also known as S-ala. Okay? S-ala. Okay? With the help of that one, you'll get, with the help of another enzyme, which is S-ala dehydrase, which will dehydrate the S-ala, it'll become porphobilinogen. And that is where we have a problem with lead poisoning. That is what is inhibited when you have excessive lead levels in your plasma. Okay? Acute intermittent porphyria, we have porphyria cutaneous tarda. That's associated with with porphobilinogen deaminase deficiency. Okay? Please be mindful of this one. Okay? Next is, the next thing that happens is because of the deamination of porphobilinogen, you'll have hydroxymethylbilane. Okay? Hydroxymethylbilane will become uroporphyrinogen 3. Okay? And then you'll have another decarboxylase enzyme that will turn it into coproporphyrinogen 3. Okay? Now, the main problem with Porphyria cutánea tarda, which is another version of porphyria, is due to the deficiency of uroporphinogen decarboxylase. Okay, those are the things that you need to remember. Okay? Next, coproporphobilinogen becomes protoporphyrin, which then combines with the iron molecules, okay, to become heme. Okay? Now, another problem with lead poisoning is what? It inhibits the ferrochelatase enzyme. This one, ferrochelatase enzyme. The ferrochelatase enzyme. What does it do? It allows iron to bind to protoporphyrin. Protoporphyrin cannot form heme without iron. It'll just go to circulation, and that's the reason why. Okay, that's the reason why you will have an allergy, so to speak, with light, because this one is photosensitive. The protoporphyrin, okay, and the uroporphyrinogen causes oxidation that makes the blood cells, or specifically the red blood cells, to explode in circulation. Okay? All right? Clear? Clear ba tayo kung sa ano ang problema natin pag may lead poisoning? Because you'll see sideroblasts. Okay, you'll see sideroblasts, which may confuse you to know that it's a case of sideroblastic anemia. How do we test for all of this? Sir, oo nga naman sir. Pang doktor man yan. Medtech tayo, kailangan na nating alamin yung nasa right side. Ito nasa right side lang kailangan ninyong alamin. At saka ito. Okay? Bakit? How do we test for sideroblastic anemia? We use genetic studies. Kaya nga may picture ng mitochondria dito, di ba? Because you will test mitochondrial DNA to check if the patient has S-ala synthase or S-ala dehydrase. Di ba? Medtech tayo, hindi tayo manggagamot, wala tayong pakialam dyan sa mga yan. Okay? Kasi kaya inaalam ng mga doktor tong buong linya na to, kasi gusto nilang malaman kung ano yung bibigay nilang gamot. Wala man tayong pakialam dyan, medtech tayo eh. Okay? Now, acute intermittent porphyria. Paano natin iti-test? Analysis of protoporphyrin deaminase. Paano natin yan makikita? Molecular studies again. Okay? Porphyria cutánea tarda. How do we identify that one? Study again. Find the genes that causes deficiency of the following things. Okay? What about lead poisoning, sir? Well, as I mentioned before, you could do this, but you could do peripheral blood smear to demonstrate punctate basophilia, or you can use what? You can use clinical chemistry. You can go to clinical chemistry. What do we test for? Heavy metal poisoning panel, 'di ba? Kasama doon yung lead. Okay? Clear? Kung bakit important, hindi ko papaalala sa inyo yan, class. Naku, Diyos ko, masakit sa ulo yan. Ang kailangan nyo lang maalala ito at saka ito. Okay? Clear? Kaya nga may drawing. Sabi ko maganda to pakita sa mga students ko para sa example, para sa lecture later. Alright, so I'm gonna stop presenting, and I want Moyo to kick me out of the discussion so we can move on with our lives. Okay? Clear ba, Renmar? Clear ba? Kinig tayo dito, anak ha? Kinig tayo, okay? Alright. Taray. Wag pabubulain ang bungangan ni Sir Marco, ha? Okay? Alright? Okay. Nasaan na si ano? Please kick me out na. Okay? Ayan. Okay. Alright. So we're clear with everything? Clear? Clear tayo, class, ha? Wala tayong problema. Anything that you need to add, anything that you need to ask me before I go, because I don't want to be distracted by questions that I've already answered. Wala. We can move on. Do you think we can move on by? They can still follow? Okay. Pag nagtanong ako mamaya kung paano yan, patay tayo dyan. Patay na naman tayo dyan mamaya. Alright. Now, aminolevulinic synthase assay or 8-ala synthase is the deficiency in most cases of porphyria. Okay? But for Porphyria cutanea tarda, the problem is what? The problem is Porphyria cutanea tarda is uroporphyrinogen decarboxylase, which is responsible for what? For conversion of uroporphyrinogen 3 to coproporphoninogen na ano ako nabulol, coproporphyrinogen 3. Okay? Coproporphyrinogen is the precursor molecule of protoporphyrin, which can be converted to heme in the presence of ferrous iron. Ferrous ba or ferric iron ang present sa bloodstream natin? Ferrous or ferric? Before we move on, because I know it's leaning towards clinical chemistry, but I want to see if the students are able to okay. Valiant answered already. Okay. Ferrous ba or ferric? Sige nga. Ferrous daw. Nagsama-sama ang sabayan ng Becky. Okay. Hindi ka kasama doon, James Paul. Okay. Si Patrick, we don't know. Still. Okay. Ferrous. A lot of people said ferrous. Ferrous. You're correct. Okay. So we'll stop with this one with Lil Zo. Lil Zo, I haven't seen you yet. You didn't say good morning to me. Okay. Where's Lil Zo? I didn't see Lil Zo today. Medyo tahimik ang mga students today. Where's Lil Zo? Lil Zo, where are you? Girl, where you at? Oh, there you are. Sorry. Alright. Okay, so aminolevolinic synthase. Let's go with acquired sideroblastic anemia. I think that's the next thing that we're going to talk about. Now, acquired sideroblastic anemia is due to the following reasons. You are either taking isoniazid, okay, or lead. Now, I told you earlier that we overlap with certain subjects that you might have taken before. Isoniazid, what is it used for? What drug is it used for? Valiant. Alam ni Valiant yan kasi meron siya dati niyan. Sige, go. Charot lang. Ano? Very good. Isoniazid, rifampicin, ethambutol, right? RIP in short, rifampicin, isoniazid, pyrazinamide, dagdagan pa natin ng ethambutol pag hindi talaga pag hindi pa talagang resistant talaga. Okay? Streptozinamide kung talagang super na talaga. Okay? Wag niyo kakalimutan ng RIPES. Okay? Yun ang ating shortcut ang mnemonic kung ako man ang mabibigyan ng kapangyarihan magturo sa inyo ng micro or bacteriology, we will go to that one. But for now, let's talk about isoniazid first. Isoniazid causes sideroblastic anemia because of what? Because it can interfere with vitamin B6. Remember that chart earlier? Right? Remember that chart earlier? Why did I mention vitamin B6 earlier? Right? Because because class, huwag kakalimutan, S-ala synthase cannot convert glycine and succinyl CoA to S-aminolevulinic acid, or what we call S-ala, without vitamin B6, because vitamin B6 is a cofactor. Okay? It's a cofactor. And with isoniazid, it blocks the activity of vitamin B6 because it causes a competitive reaction. Kaya nga 'di ba kaya nga laging sinasabi ng mga doktor, hinahanap nila kung ano yung history ninyo, 'di ba? Like for example, last time si Valiant pumunta sa doktor niya. Ano ba? Pwede ba natin ikaw bigyan ng pwede ba natin ikaw bigyan ng isoniazid? I think hindi pwede kasi mababa ang vitamin B6 levels mo. Okay? So mag-alternate na lang tayo with ethambutol and streptozinamide. 'Di ba? Ganon. Huwag niyo kakalimutan si Valiant kasi siya yung example natin ngayon sa TV. Okay? Wala akong mahanap na mapayat. Ikaw lang yung nahanap ko mapayat, bakla. Chill ka lang. Okay? Wala akong mahanap na mapayat eh. Hindi ko pa nakikita si Mark Segi kung mapayat ba si Mark Segi. Okay? Hindi naman pwedeng si Mel. Hindi naman pwedeng si si Patrick. Mukhang masarap kasama kumain. At lalong-lalong hindi pwede si Leila at saka si 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 sino yan si Audrey at saka si Renalyn. 'Di ba? Okay? Hindi ko pwede, ikaw lang ang pwede ko makita kayo na kasi last time nakita ko yung ang body natin, it's very what's that drag queen's name? I forgot na. But let's forget about it. Let's move on to the next slide because my ADHD is kicking in again because I'm not on my meds. Charet! Charet lang, wala akong ADHD. Undiagnosed, kumbaga. Anyways, let's move on. Siguro kaya mabilis ako makaalala dahil dyan sa may ADHD. Because most people with ADHD, they have good memory or long-term memory. Anyways, enough about my ADHD. Let's talk about that. Let's talk about what is the relevance of vitamin B6 in the study of sideroblastic anemia. 'Di ba? Bakit kailangan nating matandaan? B6, as I mentioned before, is a cofactor to produce ALA synthase. Okay? It's an important enzyme in producing heme molecules. Okay? Iron is deposited in the mitochondria since it cannot bind to the heme molecules. Okay? That's why you will see punctate basophilia or basophilic stipplings. Okay? Clear? Clear na tayo? Kasi sir, wala namang kinalaman ng iron. Syempre, kaya ka nga walang kasi nga, hindi gumagana yung B6 mo, hindi nagko-continue yung pathway. Okay? Yung porphyrin pathway. Kasi baka mamaya magtatanong sa akin si Leila. Sir, you lying? Sir, you lying? What's the relevance of iron? What's the Leila, I will answer you right now. Okay, Leila, kinig tayo dito, Leila ha. Leila, hindi magtutuloy ang pathway. Leila, nasaan ka, Leila? Galawin mo ang baso. Leila, nandiyan ka ba? Leila Ramel Gonzalez. Ayan. Leila. Okay? Listen tayo dito, kinig tayo ha. Hindi matutuloy ang pathway kung isa doon sa mga sinabi ko na enzymes ang mawawala. If there is no enzymes, the pathway will not continue. If the pathway do not continue, there will be an overload of iron. And therefore, where will the iron go? It will deposit in the mitochondria of the RBCs. Clear, Leila? Kinig tayo, Leila, ha? Kinig tayo, Renmar. Alright, let's move on to the next slide. Lead poisoning. Ano ba to, sir? Puro mga lason ang pinag-uusapan natin. Huwag kayong mag-alala, madaming mga babae, mga lason sa amin yung mga Becky. Mga lason yan kasi inaagaw ninyo sa amin ang mga kailangan namin. Charing lang, pumapasok na din kayo sa mga applications namin like Tinder and nakakaloka kayo. Ganun. Char lang, gusto ko lang kayong sumaya, okay? Okay? Alright, so what is the effect of lead poisoning to him? Ano yan? Mali na naman ang grammar ko dyan. Hindi ko pala talaga inalis. Akala ko inalis ko na yan kanina. Anyways, what is the effect of lead poisoning to heme production? Well, as I mentioned before, isa lang ang nilagay ko dito kasi hindi pa updated ang study noon. 2017 yata na-discover yung ability to inhibit ni lead poisoning ng dehydratase, the S-ala dehydratase enzyme. But originally it was discovered that it was first discovered in 1918 that it inhibits ferrochelatase. Okay? It inhibits the action of ferrochelatase. And ano nga function ng ferrochelatase, class? From the name itself, ferro, iron, chela. Ano yung chela? Separating. 'Di ba? Separating. Okay? Latin lahat tayo. Ang dami naman, puro Latin, sir. Ano yung ACE? Pag may ACE sa dulo, enzyme siya, ha? Huwag kakalimutan, Renmar. Huwag kakalimutan. Okay? Ferro. So, anong tinatransport niya? Iron. Okay? Iron. Sineseparate niya. Anong sineseparate niya? Iron. To where? To nabubulol na naman ako. Protoporphyrin. Okay? Protoporphyrin. And once that happens, you will form, Leila, ano nga yon? Heme molecule. A stable heme molecule. Okay? Okay, Leila? Clear, Leila? Renmar? Kim? Kylie? Clear? What about Bai? Si Bai parang ano, si Bai parang nagsiswimming. Gusto ko makita ang buong mukha mo, Bai. Okay. Ayan, o, diba? Kaganda naman kaya ni Bai. Diba? I forgot to say salamalaikum. Salamalaikum, Bai. Alright. Let's move on to the next slide. Okay. The function of ferrochelatase. The function of ferrochelatase is that it's an enzyme that is responsible for the insertion of iron molecules or ferrous iron molecules or ferrous iron molecules to protophore pyrene to form heme. Okay? Yan na yon. Kaya hindi ko diniscuss yung heme metabolism at ano dun sa previous slide natin. Because I know I will discuss it when I discuss iron deficiency anemia. And girl, I don't play with y'all time. Okay? I don't play with y'all times. I want it to be all on the dot. Whenever we need it, we need to know it. Okay? Right? When we need it, I'll talk about it. But if it, because I don't play with y'all time. All right? All right. Let's move on with the next slide. How can sideroblastic anemia be detected in the laboratory? Ayan na naman tayo. Nakakainis naman, sir. 'Di ba sinabi na natin kanina yan? It can be detected using what? It can be detected using the peripheral blood smear. Or, sorry, not the peripheral blood smear, bone marrow smears. Using what? Using Pearl's Prussian blue. You will, what? You will demonstrate ringed sideroblasts. Okay? Using Pearl's Prussian blue. That's in the bone marrow. It's a bone marrow study. Okay? Clear? Clear pa tayo? Pearl's Prussian blue. Huwag kakalimutan. Pag Prussian blue tayo, yan yung ano, yan yung tatandaan nyo lang. Iron ang kinakabitan, dindikitan niya. Okay? What specific form of iron? Ferrous. Okay? Alright, let's move on to the next. Nasaan ang isa kong ano? Ang isa kong kasi may mga announcement ako ng prices later. Kasi only I think 8 people submitted their birthday greetings and I was serious. I talked with Sir Marco about it. There's a couple of people who I would like to give commendations to. Okay? And malay nyo, yung 8 na yon magkakaroon ng prizes. Kaso, mukhang hindi maganda kasi pinabula nyo yung bunganga ni Sir Marco eh. Dapat hindi ganun ang start ng natin, ng class natin. Okay? Huwag nyo pabubulain yung bunganga ni Sir Marco. Okay, class? On ang camera, naka-uniform dapat lagi ha. Huwag nyo pabubulain. Okay? Titingnan natin kung mabibigyan ng +1 yung mga hindi nanalo. Okay? Kasi I already asked a group of impartial judges who are my co-workers, okay, to see who gave the most heartstring pulling video. Yung naiyak kami, yung pinaka naiyak kami is a certain person. You will not believe it. Akalain nyo, no? Akalain nyo, yun yung nagpaiyak sa akin. Ipopost ko yung picture mamaya. Okay? But anyways, ipopost ko yung picture dyan sa share. But anyways, let's move on. Clinical chemistry results that can differentiate sideroblastic anemia from iron deficiency anemia. Ano nga yon, Valiant? What's the answer to this one? Kanina pa ako pa ulit-ulit. What are the clinical chemistry results that can differentiate a patient with sideroblastic anemia from iron deficiency anemia? Kanina pinaalala ko yun sa inyo. Clinical chemistry. If there's a slide that you need to remember this slide. Come on. Who can answer? Sabi ko na eh. Makakalimutan nila, di ba, Bay? Nahulaan na natin kanina, Bay, di ba? Kim. Oh, di ba? So makikita natin sa sa sideroblastic anemia. Os? De, tama. Tama ka. Pero how do we measure? Di ba I told you earlier, we don't measure transferrin directly. In the clinical lab, we demonstrate it using what? Assay? Jomel. Ngayon ko lang nakita si Jomel. Hi, Jomel. Jomel. Good morning. Okay. Very good. So TIBC ang dinimeasure din na for transferrin. Okay, that's an analog. Okay, an analog assay for transferrin. Okay, let's see the answers. Let's see if Jomel is for the very first time, he answered something. Okay. So these are the things that you need to remember because most of the times, examiners will ask this. Okay? Most of the time, examiners will ask this. Okay? So, kailangan maalala nyo siya. Huwag nyo din kakalimutan ng iron. Sir, bakit sa sideroblastic anemia maraming iron? Kanina nga, di ba, sinabi ko kay Leila, kay Renalyn tuloy, kay Leila, di ba? Di ba, Leila, sinabi ko sa iyo kanina, once na-stop ang any of the other, or once the other enzymes are inhibited for some strange reason, it could be a genetic disorder, it could be an acquired reason, there would be iron overload. Di ba, Leila? Sinabi ko sa iyo kanina, right? So, kaya increase yung iron niya. Bakit sa iron deficiency? Wala. Kasi nga wala kang dietary fiber. Huwag niyo kakalimutan si Dayan, di ba? Hindi kasi siya makabili ng spinach. Okay? Kasi hindi alam nung tindera kung ano ang Tagalog ng spinach. Hindi ko talaga maalala. Siya ba yung Siya ba yung anong tawag doon? Kangkong ba ang spinach? Hindi watercress ang spinach eh. If anybody can answer me that one, I'll try to give somebody a prize. Okay? Anyways, let's move on to the other disease that we're going to talk about. This is thalassemia. I think we've discussed it in depth earlier. What's the difference between major and minor thalassemia, right? Has something to do with the presentation, correct? I also told you how to read the electrophoretic results. Nakinig ba kayo doon or wala lang? Pagod na ako, sir. Valiant, nakinig ka ba doon? Be honest. Usap tayo, kaibigan. Kaibigan, usap tayo. Ano ang naaalala mo sa electrophoresis last week? Bro ha, panuorin mo lang paulit-ulit, maintindihan mo yan. Okay? Anyways, kay Segi ka pa talaga nagpaturo. Ha? Kapwa Suki card member. Kapwa Suki card member mo. Talagang kay Segi pa talaga. Hindi ba pwede kay Renmar? Sa kapatid mo. Ha? Sa kapatid mo na kahapon ko lang iniluwal. Hindi talaga kay Diyos ko ha. Ikaw talaga ha. Alright. Anyways, enough of that commercial. So we basically know, pag sinabi natin alpha thalassemia, ang problema is what? The alpha genes. The genes that produce for alpha, right? What is the difference between major? Diba? Naalala nyo? If it's alpha thalassemia major, the problem is the genes, and there is what? A homogeneous or heterogeneous inheritance of the traits. Patay. Nakalimutan. Si Jomel nagta-type. Hindi ko alam kung ginugoogle niya or what. Pero, sasabihin ko na Jomel. Hindi. Gumaganon ka kasi Jomel eh. Sorry. Sabihin ko na, pag homogeneous, it's thalassemia major. Huwag niyo kakalimutan yung ganyan, yung alpha-alpha. Ganyan. Diba? Homogeneous inheritance. Huwag niyo kakalimutan yan. Okay? And huwag niyo din kakalimutan yung ganyan. Heterogeneous naman yung ganyan, 'di ba? Meron pa tayo yung cis and trans, 'di ba? Cis and trans inheritance traits. Okay? Huwag niyo kakalimutan. All right, let's go to the discussion of thalassemia. Abnormality that is present in patients with thalassemia is an abnormality in the hemoglobin chain production. The other one that we discussed is the heme production earlier, the porphyrin pathway. This one is the hemoglobin chain production. Ito yung globin portion niya. Okay? Hemoglobin is produced by two things, heme and globin. Do not mistake the two as one. Okay? Okay, Leila? Okay, Jomel? Okay? Alright? Do not mistake the two as do not combine the two and do not combine the two molecules together when you're studying for hemoglobin. You have to study them separately kasi you might make a mistake when it comes to the enzymes. Okay? All right. Now, let's talk about the next thing that is of course in our minds. Paano ba nagkakaroon ng thalassemia? So, you're obviously it's a genetic anomaly, but what chromosome? Chromosome 16 for the alpha chain, chromosome 11 for beta chain. And basically, the alpha chain has 4 genes and the beta chain has 2 genes only. Okay? So clear? Clear, clear, clear? All right? Okay, so this is just a quick review. I think I've already discussed this last week. So we'll pass by this one a little bit faster because there's other disorders. Girl, there are other things that we need to discuss. I don't want to be playing with your time. Okay? All right. Now, nomenclature for the type of thalassemia is based on, I think you guys remember already, the deletion of which globin chain it is, right? So if it's alpha thalassemia, it's the deletion of alpha chains. If it's beta thalassemia, it's the deletion of the beta chains. Can we see if my answer is correct? Yes. Okay, so deletion of the globin chain. Alpha thalassemia, deletion of alpha chains. Clear? Let's move on. Let's move on to the next one. What are the types of gene deletions in alpha thalassemia and indicate what type? Oh, this is something that I didn't discuss last time. Okay, so remember that we have 4 alpha genes, right? It's expressed like this, right? So we have 4 alpha genes, right? So if I say, for example, you have 1 gene deletion like this, this is what? Thalassemia major, thalassemia minor. Keyboard warriors, type na lang, survey. This one the one on top. The latest one that I had. I'll put a line here, and then I'll put again the question. What type of thalassemia do you have if you've inherited this type of genome? Your answer would only be major or minor. Come on, people. Sabi ni Jenilyn, minor. Okay. Sabi din ni Mel, okay. Sabi din ni Claire, okay. Walang papalag sa majority. Parang feeling ko majority mali. Wala. Oh, taray, James Paul, oh. Okay. So, Krisha also says minor, and since Krisha is the last one to answer, I already put a dotted line, which means you stop answering. Okay? Krisha, where are you? Introduce yourself. Krisha, where are you? Krisha? Scenaris. Oh, there you are. Hello. Where are you? Girl, where you at? Okay. So, Krisha, why did you say it's minor? I know I've already mentioned the answer, already mentioned the answer a couple of minutes ago, but I just want to make sure that you have a full understanding of why you called it minor. Krisha, why did you call it minor? Okay. That's taking a little bit long. Let's go with James Paul. James Paul, if I may, please raise your hand if you're available. Ay, wala si James Paul. James Paul, saan ka? Wala din si James Paul. O sige, yung last person na lang. Ayan na si James Paul, sorry. Ayan na, James Paul. Why did you call this minor alpha thalassemia? Sige nga. Why did you call it alpha thalassemia minor? Wala. Okay, so hindi talaga. Okay, let's go with Renmar Canlas. Nag-skip ako kay Leila kasi kanina ko pa tinatanong si Leila eh. Feeling ko gets na ni Leila. Leila, gets mo na 'di ba? Kaya nag-skip na ako sa iyo. Ha? Hi. Kakasabi ko lang kanina heterogeneous or homogeneous in. Hoy, ano ba 'to? Ano ba muna 'to? Oh, anong tawag dito? Oh, ano yan? Homogeneous or heterogeneous inheritance of thalassemia traits? Nakalimutan na, last week lang natin yan pinag-usapan, ha? Oh. Homogeneous kasi dalawa, 'di ba? 'Di ba? Same, 'di ba? Ganon. Yun talaga, ha. Okay. All right. So there are 4 types, okay? So I'll go one by one. One gene deletion is that one that I showed you guys earlier. You all answered minor thalassemia. Let's show them, okay? Let's show them the answer to this one. One gene deletion is this one. Okay? And this is considered as asymptomatic thalassemia. You're probably the carrier. Okay? Now, two gene deletions is known as, two gene deletion is this one. Okay? Or it could be this one. Okay? Doesn't matter. Okay? It could be this or that. Okay? And it's characterized by mild anemia. You're still considered to be, you're still producing alpha globin chains. Because remember, this is a quantitative hemoglobin disorder. Okay? Next is three deletions. So it's gonna be something like this. Your phenotype is something like this. It's characterized by severe anemia. Okay? And of course, four deletions is you're basically not producing any globin chains at all. So you either die in the fetal stages after your mother gives birth to you, if you're somebody like that. And what is the hemoglobin chain present if you have hydrops fetalis? What is the hemoglobin chain that is present if you have hydrops fetalis? Come on, people. You forgot already? Oh, no. These are questions that they ask in the board exams, people. Oh, I've just talked about that last week. Oh, no. Let's go to who else is here? What about Patrick? I've not seen Patrick yet. Patrick. Oh, it's fine. You can answer. What abnormal hemoglobin is present in patients with three or more gene deletions of alpha thalassemia? What abnormal hemoglobin chain or what abnormal hemoglobin is present? I think that's the next slide, by the way. Um, what abnormal hemoglobin is present in patients with three or more gene deletions of alpha thalassemia? Very good. Oh my gosh, somebody remembered finally. All right. HBH are also known as what? By the way, James Paul, I like the lights. I love your lights, by the way, James Paul. Can you show that to me? Oh my god, I love the lights. Okay. Anyways, let's move on. I love his room. He has a gamer room. Okay. So Bart's hemoglobin or HBH, all right? This is because there's the absence of alpha globin chains, okay? Alpha globin chains. All right. Now, what is the reason? I think that the next question is, of course, we're going to talk about hydrops fetalis. HBH hydrops fetalis occurs because of HBH. Why? That's the question. What is the reason? Because HBH has high oxygen affinity and it cannot transport what? It cannot transport oxygen. Sir, akala ko high oxygen affinity. Hoy, hindi yun same with oxygen saturation ha. Please do not forget oxygen affinity and oxygen saturation is different. Because some of my students last time, I put this is I think Valiant was one of the students. Oh no, you're microbiology, right? Last year we were microbiology. No, no, no. You weren't my student there. Sir Marco's class was asked the question, true or false? Hydrops fetalis has high oxygen saturation. A lot of them answered true. Well, in fact, it's high affinity. Affinity is the binding capacity of oxygen. Saturation is the ability of the oxygen to be transported to the cells. That is different, okay? So it's like this, okay? It's like this. Nagkaroon ng boyfriend si Renmar. Ang pangalan niya, hanap na lang tayo ng ibang pangalan. The most common white guy name, Afam. Hanap tayo ng Afam na pangalan. Alex, okay? Uy, pogi yung katrabaho kung si Alex, ibebenta kita doon. Okay? Pogi yung katrabaho ko na si Alex. Mahilig ka ba sa Latino? Puti yon. Puti, half Latino. Anyways, imagine Alex as the hemoglobin molecule and Renmar is oxygen. Clingy si Renmar. So, ibig sabihin, pag magpupunta sila sa kung saan-saan, laging nakaakbay si Renmar. Okay? imagine the store as your tissues. Pupunta lang for example ng boutique si Alex, nakadikit pa rin si Renmar. Ayaw humiwalay, hindi makapagsuot ng damit. Nagpunta sila sa Tommy Hilfiger or sa pa ba magandang mga mamahaling mga sosyal sa Lacoste na boutique, nagpunta silang dalawa ni Alex. Ngayon si Alex sobrang pogi, ayaw bitawan ni Renmar. Syempre, paano niya masusuot yung sweater na gustong bilhin niya, no? So, yun ang ibig sabihin. That is my analogy of what? Affinity. Saturation is yung paghiwalay ni Renmar. Renmar, kuha mo, can you get my, sabi niya, baby, o kaya, baby, mommy, ganun, mommy, get me that jacket. That is saturation, okay? Saturation is the ability of the oxygen molecule to move about the tissues. Okay? Huwag kakalimutan ang affinity and saturation, ha? Tandaan nyo lang yung mukha ni Renmar na yan. Siya yung oxygen molecules dun sa analogy na yon. Okay? Clear ba, James Paul? Clear ba, Kim? Clear ba, Patrick? Clear ba, Leila? Walang nag-react. Okay, walang nag-react. Patay tayo na naman dyan. Pag ako nagtanong na naman, patay tayo dyan. Ay, hindi na ako magtatanong kaya. Exam na lang kaagad. Hindi na lang ako magtatanong. Alright, now, next question. Let's see if my answer is correct. HBH has an extremely high oxygen affinity. Hindi nga humihiwalay masyado, di ba? Sabi niya, Mommy, I need to get... No, I'm going to stay here with you, baby. Ganon, di ba? I'm going to stay here with you, baby. I'm not gonna... you play with my tab. I'm here in the store with you. I want to see you, not the sweater. Ganon yung banat ni Renmar, di ba? Okay? So, yon. Kaya high oxygen affinity is extremely dangerous. What other hemoglobin variant do you think has high oxygen affinity? I'll give you guys choices. Sulfhemoglobin, carboxyhemoglobin, and methemoglobin. Which one do you think has high oxygen affinity? Nagkopyahan na naman sila. I'm talking about oxygen affinity, okay? Answers, class. Answers. Huwag gumagaya basta-basta. Don't be sheep. Okay? I think everybody's a sheep. I'm not seeing other answers. Everybody answered what? Anim lang student ko? 6 lang ang student ko? Math din ang sabi nila. I'm a little bit disappointed. Alright, let's stop with bye. I'm a little disappointed, people. The answer is not methemoglobin. Okay, so you have 2 more choices. Okay, people. Select. You have 2 more choices. Carbox lang. Specific. I want specific answers. Carbox daw. Mali ang sumagot ako. Mali na yung first 2, ha. Mali yung first 2. Carbox na kasi nulat nila. Oh. At least si Gracie alam niya yung nomenclature. Okay. Alright. Okay. So let's go and stop with Krisha. Okay. So Andrea Nicole Luciano. Where's Andrea? Andrea, where are you? Wala. Andrea. Okay, Andrea, what is your problem when you have carboxyhemoglobin in your system? What is your problem? Clinical chemistry also. I think this is Kim Kylie. Hypoxia, yeah, of course. But what is the brain? What is the reason why you're having hypoxia when you? Very good. Carbon monoxide poisoning. Very good. Now, what is the common cause? Now, health. Nice to know question. What is the most common cause of carbon monoxide poisoning in many cases that we encounter in the ER? Kim. Very good. A lot of the children, a lot of pediatric patients come into the hospital. Okay, they come to the hospital with severe hypoxia because their parents left them in their cars. So never leave children in the car seat, okay? Especially when the engine is running, okay? Especially when the engine is running. Where does the carbon monoxide come from and what does it smell like, sir? It's colorless and it's odorless. Okay? All right, so that's the reason why it's extremely dangerous. Your house could be. Actually, there was a story here a couple of days ago in Inside Edition when I was watching the television. A whole family died from carbon monoxide poisoning. You know what happened? The patient the father who was driving home from work accidentally left the car open. They had the Tesla. The Tesla, paano ba ang pagpatay ng Tesla? Di ba? Yung papatayin mo with the with the fingerprinted key card. So nakalimutan niya yon. So naiwan niya yung kotse niya nakabukas for the whole day. And then they woke up. They didn't wake up after that because they're all dead. All right? So that's the reason why. That's the reason why it's important that you guys turn off your not Tesla. Tesla is electric. That's the other one. Yung hybrid car. Sorry, not Tesla. Okay? So be careful, okay? Be careful with that one. How do we avoid that? Buy a Tesla. Okay? Anyways, let's move on to the next slide. Yes, you can afford to buy. Naku, kailangan mag-aral tayo, Valiant. Alam mo bakit? You can afford a lot of things. My goodness, if wag ka na magbidisi. Charet. May bala ka ba magbidisina, Valiant? Wala. Naku, Valiant, aral tayo, Valiant, ha? Kinig tayo, Valiant, ha? Para hindi na tayo mabigyan ng sukikan. Naku, Valiant, ang bilis. Naku, Diyos ko. Diyos ko, Valiant. Naku, you can afford a lot of things here. Your wigs, a lot of things, okay? But anyways, enough about me and my ADHD. Let's move on to the next question. Okay? What types of gene deletions are present in the following populations? Sir, tinatanong yan. Yes. Asians have a cis deletion, while African Americans and Africans in general have a trans deletion. Deletion on the same chromosome, deletion on different chromosomes. Okay? So those are cis and trans deletions. Okay? Mnemonic, huwag nyo lang kakalimutan. Okay, mnemonic. Alphas are associated with Asians and Africans. Okay? Always remember A. Okay? Only what you need to remember is the cis and the trans. Okay? Cis and trans. Cis and trans ones. All right? Don't forget. But I think most of the questions that you will be asked in the exam is which of the following gene deletions are which population have alpha thalassemia, which of the majority of the time you'll get Middle Eastern, you'll get African, you'll get Asian. And I know it kind of sounds racist, but it is backed up by science. Okay, there's nothing racial about it. We're not demeaning anybody. Okay, so please put that in your very woke minds, because I think a lot of students right now, sir, that is racist. Why only Asians? Well, that's what happened. That's what happens. It's biology. Okay. All right. And I have no answer about other than that, because everything is backed up by science. Anyways, let's move on from the woke movement to another topic. In which population is beta thalassemia present? I think you guys already know. Kakasabi ko lang kanina. Oh my God, I miss Nicolo. Huwag niyo kakalimutan si Nicolo kasi he's Italian. Alright? Mediterranean. He's Mediterranean. Okay? Nicolo. Okay? Huwag niyo kakalimutan. Italian people or Mediterranean people usually have beta thalassemia. Actually, I want to add, ever since I started working in Saudi Arabia and some portions of the Middle East, Mediterranean people isn't just common. Isn't just for beta thalassemia. I think Arab people from Arab descent or Middle Eastern descent get beta thalassemia. But majority of the time, um, Mediterranean people. If you're going to ask a question, okay, in the board exam, remember Mediterranean people. Okay? All right? You might have a case also. All right? You might have a case study about that one. That's why you need to remember these information. The information presented to you. Okay. Now, let's move on to the next one. Okay. What are the types of beta thalassemias? You have minor, intermediate, and major. Okay. So major is both hemoglobin genes are blocked. Okay. Intermediate is co-inheritance of alpha trait and beta trait. What do you mean by co-inheritance? Abnormal na nga yung alpha chain production mo, abnormal pa yung beta gene production mo. So there's a combination. Okay? Intermedia, hence the term intermedia. Minor is asymptomatic and mild anemia. Okay? So that's the reason why I only write the alpha genes. Last time, I never talked about the beta genes. Sorry, the beta genes, because there's two things that they have different they have different terminologies. Okay? All right. What test is used? I think that's the next slide. What test is used to do a differential diagnosis of beta thalassemia major from beta thalassemia intermedia? Minor. Minor from beta thalassemia intermedia. Beta thalassemia minor can be done using hemoglobin can be differentiated from beta thalassemia intermedia using electrophoresis, hemoglobin electrophoresis to be specific. Okay, minor has the following results. Can you please show them? Okay, minor has HbA decreased, HbA2 markedly increased, and HbF markedly increased. While for patients with beta thalassemia intermedia, everything is decreased or there's no activity for HbA2 and HbA1, whilst there is a predominance of HbF. Sir, paano ko maaalala, sir? Huwag niyong kakalimutan. Wag niyong kakalimutan. Ganto na nga yung ganto na nga yung genotype ng alpha genes nyo. Tapos meron ka pang ganto na beta gene. Okay? So, ano na lang ang mangyayari sa iyo? Anong mapoproduce mo? Every time merong abnormal hemoglobin chain. And remember, HbF, the production of HbF is a compensatory mechanism of the human body para matuloy kang mabuhay. Okay? Lagi nyo lang tatandaan, compensatory hemoglobin ang hemoglobin F. Okay? Hemoglobin F. Hindi siya bumalik sa pagkabata pag sinabing HbF. Ay, si Valiant, predominant hemoglobin variant niya is HbF. No, hindi siya bumalik sa pagkabata. Okay? Ibig sabihin nun, merong problema yung pasyente sa production ng hemoglobin chains niya. Okay? So, tandaan nyo, ay, mali pala yung ko kasi minor trait lang yan eh. Ganito pala. Ganyan yung production nyo. Kaya decreased or none. Paano yung none, sir? Pag none, ganito na lang yung itsura ng mo. Kawawa ka naman. Yung 3 gene deletions ka na nga ng alpha chain. Tapos, meron ka pang gene deletion ng beta chain. 'Di ba? So, see, how many chains of alpha and beta chains do we need ba, class? Who can answer that one? Let's go back to the structure of the hemoglobin molecule. Nako, nakalimutan na din. Tandaan, basics. Remember, basics. Huwag kakalimutan yung goer 1, goer 2, goer 3. I think hindi nyo makakalimutan yan dahil titingnan nyo lang kami tatlo ni Renmar, Valiant, at ako. Ako si goer 1, goer 2 is Valiant, tapos si Renmar si wag naman yung kakalimutan. Ako, diba, easy ako makuha, ligawan mo lang ako, papala. Di ba? Di ba? Wag naman yung kakalimutan si Val. Witty, Renmar, witty. Natawa si Renmar. Di ba? Di ba, alala nila. Ngayon, normal naman tayo. Paano ang normal, Renmar? Ano ang beta? Ano ang composition ng mo? Pag may HbA1 at saka HbA2 ka. HbA is what? Alpha and beta, hoy. Kayo talaga ha. Alpha and beta yung niya. Ang naalala, yung easy-gazy gagawin. Pero yung normal, hindi niya naalala. Embryonic yun pati ha. Baka mamaya nakalimutan nyo din. Okay, alpha and beta. But how many? 2 alpha, 2 beta, di ba? Di ba? Nakalimutan nyo na. Okay? So, hopefully, wag nyo makalimutan yun. Alright? Wag kakalimutan. Okay? Next. Let's go to the next slide. Okay? Let's go to the next slide. Another term for beta thalassemia major. Another term for beta thalassemia major. Ano ba yan, sir? Kailangan ba yan, sir? Malaman? Yes, of course. Another term for that one is Cooley's anemia. Okay? Sorry, Mel. I'm terribly sorry. I answered the question for you. But you'll have another opportunity to answer a question next time. Thank you for your birthday message pala, guys. Nakalimutan ko si Renmar, si Mel. Sino pa yung isa? That guy. Who's that guy and that girl? I only remember Mel because they're the only ones answering the questions all the time. Who's the other one with you in your video, Renmar? There's another guy there who had my picture upside down. My goodness. I don't know. Okay. Titingnan natin kung makakakuha ng ano ha. Kung makakakuha ng plus. Yung mga ano, mga yon. Medyo bumubula pa yung bunganga ng Sir Marco ninyo eh. Kasi naman kasi eh. Kayo naman kasi eh. Okay? Titingnan natin mamaya ha. Okay? Kasi wala sa group ninyo yung nanalo. Sinasabi ko na. Sinasabi ko na. Creative good kayo. Pinaglaban kayo ng mga katrabaho ko. Sabi niyo, they tried their best. Manuel, they tried their best. You're not giving them anything. I'll try my best also to ask for an addition. Kasi sayang, time na nag-edit kayo, 'di ba? Tapos script writing kayo, 'di ba? That takes a lot of work, 'di ba? So, 'di ba? Mahirap ako gumawa ng exam, remember? Yung points na ibibigay ko, yung points na possibly na ibibigay ni Sir Marco, kung hindi pa kung medyo malamig-lamig na yung ulo niya mamaya. Okay? Tingnan natin. Tingnan natin, Renmar, ha. Dapat answer ka ng answer, ha. Okay? Renmar, ha. Okay? Alright. Now, what cells are predominant in the blood smear? Or let's talk about what's the blood picture of a patient with thalassemia. Sige nga. Blood picture of a patient with thalassemia. I didn't put an answer on that one. I think I put it somewhere else. What happened to that? Can you check if there's an answer to that one, Moyo? I don't think I put an answer to that one. Yeah, I don't have an answer to that one. But who can answer? What is the predominant predominant cell present in patients with thalassemia? Nagtatanong ako ng morphology. If I said the blood picture, what cells are predominant, I'm talking about what RBC anomalies. Binago ko lang yung question eh. Kayo talaga. What RBC anomalies are present in a patient with thalassemia? Ano? Meron ba siyang schistocytes? Meron ba siyang ano? May bite cells ba siya? Meron ba siyang histios? Ay, na pala, may nagtaas ng kamay. Valiant. Sige nga. Hoy! Hoy! Cells ang tinatanong ko. Hindi ko tinatanong yung overall blood picture. Kayo talaga, kaya inuna ko to eh. Kaya inuna ko tong discussion na to. Kasi last time na diniscuss ko to, ang mga student nalito kung ano ba ang tinatanong. Oh, kata mo? Oh, ano ang tinatanong niyan? Abnormal RBC anomaly, 'di ba? An RBC anomaly ang hinatanong ko diyan. Pag yan ang question. Tingnan mo, what cells are predominant in a patient's blood smear with thalassemia? Ano ba yan? Meron ba akong Burr cells na makikita sa patient na yan predominantly? Ano ba? Shaira, sige nga. Bigyan mo nga ng kaliwanagan si Valiant. Very good. That's what I want. Girl, you got it. Can you give her a round of applause? Girl. Girl. Diba? Taray nag-react sila lahat. Active ang mga students ngayon. Kasi bumula ang bunganga ni Sir Marco. Alright. Okay. Okay. So, another name for target cells. Do you still remember, Shaira? Very good. Okay. Another name pa. May another name pa sa kanya. Talaga, sir, meron pa. Mel. Ayan na si Mel. 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 Very good. Bakit Mexican hat? Kasi nga, pag tinaob mo siya using electron microscopy, pag tinaob mo siya ng konti, yung target niya kasi tumaas siya. Tumaas yung Ang tawag doon, tumaas yung biconcavity niya. Parang, I don't want to sound crass, but you know what happens when you play around with a condom, right? You press the middle part, you play around with it, and that's what happens. That's basically what happens. I know I can't find a different an easier explanation to it. And I'm sorry if I sound crass, but for the sake of academic purposes, I'm using the analogy of when you play around with a condom, it looks biconcave, right? And you put your finger on one part of it, on one side of it, and you press on it. That's what you look. That's what a Mexican hat cell looks like, or a codocyte in 3D looks like. Okay, clear? I know I sound crass, guys, and apologies to my dear parents who are listening there, but I cannot find an easier explanation for my students to do that. But at the end of the day, the faster you know something, the better it is for you when you're taking the exams, right? Diba, Renmar? Anyways, let's move on to the predominant cells. Let's move on to anemia of chronic disease. Okay? Anemia of chronic disease. So kasama yun, yes, you could get anemia because of a chronic disease. Like chronic myelogenous, CGD, chronic granulomatous pala, not chronic myelogenous. Chronic granulomatous disease. Okay? Now, say, pabalikan natin ang story natin with Valiant. Say, for example, kasi siya yung TB patient natin eh. Okay? Alright? Wala akong ibang makitang payat eh. Okay? Sorry na. Si Renmar medyo slim eh. Medyo slim lang, pero there's still a pooch there eh. Alright? Anyways, let's move on to the main cause of anemia of chronic disease. So, it's because of an inflammatory process, and the body cannot distinguish between an infection from an inflammation. Okay? So the body can't distinguish between infection or inflammation. So it blocks the transport of iron in the bloodstream. Now the human body is well designed, but sometimes in inflammatory processes, like for example, somebody with tuberculosis, okay? Chronic disease, that's a chronic disease. That could cause an inflammatory process, right? Caseous necrosis is a result of an inflammatory process, right? Sometimes the body thinks that, oh, the inflammation, there's inflammation, oh no, the body thinks that it's an infection. So because evolution, or from an evolutionary standpoint, the body blocks the iron transport to kill off the bacteria. That's the main reason why. Remember, kaya nga tinanong ko kayo, have you thought about your blood cells today? Because your blood cells are always thinking about you. Diba? Taray, diba? Taray. Your blood cells are always, yes they are. Okay? Hindi mo sinasabi, bida-bida ang katawan natin. Kahit wala kang inflammation lang ang meron ka, ituturing niyang inflammation yan. Ay, tuturingin niyang infection yan. Kasi, i-stop niya yung iron transport. Okay? Once the iron transport is blocked, you suffer from a case of what? Iron deficiency anemia ba? No, not really, right? Because it just stops transporting iron. The body just sends off a bunch of cytokines, which we'll discuss later. Okay? I'll give you guys a bunch of examples. Aside from latent TB, okay? Aside from latent TB, you'll get CAR. What's CAR? CAR with a K, okay? Next slide, please. Okay? Anemia of chronic disease is the most common anemia in the following patients. Patients with kidney disease, CAR, K, okay? A is autoimmunity, and last is rheumatologic disorders. Okay? Rheumatologic disorders. Sir, akala ko autoimmunity is associated with rheumatologic disorders also. No, not all rheumatologic disorders are autoimmune in nature, right? It could be an acquired form. Like for example, you got infected with Streptococcus pyogenes when you were a kid. You developed anti-streptolysin antibodies, and it went to your joints, and now you have rheumatic arthritis, right? So it depends on which is a form of type 3 hypersensitivity. 'Di ba? I'm all piecing everything together. Napansin niyo kung paano gumagana ang utak ni Sir Manuel kahit na may ADHD siya, 'di ba? Nakita niyo? Ha? Kailangan you have to piece everything together when you're on the exam room. Ay when you're in the exam, when you're taking your exams, okay? Always think of, oh my gosh, ano nga ba ang problema ng pasyente kapag ka merong autoimmune disorder? Ganon. Okay? Clear? Clear tayo? Kung bakit CAR? Okay, CAR is kidney disease, autoimmunity, and rheumatologic disorders. Okay? Clear, clear, clear? All right. Let's move on to the next slide. Anemia of chronic disease is the most common form of anemia in what settings? Hospices or hospitalized patients. So for example, I became an elderly person in the next 40 years and I can't stand up. Okay, I get infected by a lot of things. I get injected by a lot of things. I develop an inflammatory response to the IV fluids that have been introduced to me kasi hindi na ako makagalaw, 'di ba? Diba? Kailangan ko na ng nutrition ko via IV infusions, 'di ba? So hospitalized patients who are chronically being treated for something. When I say chronic, it's more than 3 months, I think, or more than a week. You'll develop anemia of chronic disease because your body recognizes an inflammatory response as infection and therefore it stops the transport of iron. Okay? Now, another cause of anemia of chronic disease is a psychological disorder. Okay? A psychological disorder. Sir, talaga? Psychological disorder? Yes. Chronic alcoholics or alcoholics. Okay? Shout out dun sa mga malilig uminom dyan. Alright? Alam ko party-party bukas kasi Friday ngayon. Okay? You could get anemia of chronic disease if you're a person who is chronically consuming alcohol for the same reasons. Okay? You'll develop an inflammatory response because you're consuming large amounts of alcohol. Alcohol is not commonly found in the human body, and it will treat it as an inflammatory. It will cause inflammation. Okay, a lot of it gives out a lot of things, and the chemistry of alcohol is something that is not going to be discussed in this lecture. You'll have to find out that one for yourselves, and I think it's not going to be asked in the board exams for hematology. More on clinical chemistry probably. Okay, now important molecules that you need to remember. I think that's the next slide. Important molecules that you need to remember. Hepcidin. Okay, hepcidin. Hepcidin is produced by the liver and is responsible for iron regulation. Okay, hepcidin. Okay, hepcidin. Hep meaning it comes from the liver, and idin it's a protein. In it's from protein, but it's responsible for iron regulation. So don't forget about that one. Now the relationship of hepcidin is going to be elaborated in the subsequent slides. Serum iron is inversely proportional to the number of hepcidin present in circulation. Okay, meaning if your serum iron is low, hepcidin is high. And do we have a special way to measure hepcidin? Yes. You can use targeted, because it's a protein, you can use an immunochemical technique which targets, which basically you use anti-hepcidin molecules to target the hepcidin molecules, and then use either fluorescence microscopy or flow cytometry to give a rough estimate or an indirect measure of the hepcidin levels. Okay, so we're not gonna go with that one because that is something that is going to be that was discussed in serology. But again, let's still talk about hepcidin for a while. Receptors for hepcidin, I think, is the next one. Yeah, okay. The target receptor of hepcidin is the duodenal cells in your the ferroportin cells in your duodenum, and and basically you have ferroportin, right? Hepcidin blocks ferroportin. That's the reason why I told you how the human body is designed to stop the transport of iron. How does it stop it? Using this pathway. Hepcidin is going to be released by the liver along with a plethora of along with a plethora of molecules that indicate that there's an inflammatory response or an infection, and hepcidin is one of them. And it will bind to ferroportin in the duodenal cells. In what part of your body is the duodenum? Baka nakalimutan na din natin ang histology natin. Where is your duodenum? Anatomy and physiology tayo. Sige. Oo, yan, nakalimutan na nila ang duodenum nila. Nasaan ang duodenum mo, Mel? Mel, where is your duodenum? Medyo matagal, Mel. Where exactly? Ayan na, Andrea, sige go. Nasa unahan ng small intestine. Very good. Tara, very specific si Andrea. I love it. Okay. So yeah. So that is where iron absorption occurs, by the way. Okay? So you have your duodenum, jejunum, and your what? Ilium, 'di ba? Nakalimutan niyo na class. Ha? Kayo talaga. Back to basics nga tayo last time eh. Tapos kalimutan niyo na. Okay? So the hepcidin will be transported to the blood, and then it will block the iron and will prevent the absorption of iron. Okay? So, anemia arises because of ineffective erythropoiesis due to abnormal iron metabolism. Okay? So, magkakaroon ka ng mga what? Magkakaroon ka sa blood cells mo ng hypochromic cells kasi there's no iron in the serum. There's nothing to be transported, or there's small amounts of iron to be transported because of the hepcidin. Okay? Now, let me ask you a question then. True or false? One way the body protects itself is by releasing hepcidin. Kanina sinabi ko lang yan pero in English. Okay? Your question, that is your question. I'll give you guys time to answer the question, because you can't just you can't just guess. This in my lectures, I don't want you guys to guess. I want you guys to have a clear understanding of why you said that your answer. Your choices is true or false lang. So, when under this line, I'm expecting people to answer in how many people are in the chat right now? There's 55, 6, 7, 8, 9, 10. 55, 6, 7, 8, 59. 62. There's 62 people here, minus me and Sir Marco. So, 60 people are there. So, I'm expecting more than 60 answers. Or I'm expecting a lot of answers rather. Okay, true daw. True. Ayan na naman, Squid Game. Squid Game tayo. Mamimili si Sir Manuel. Tapos the unlucky person who gets to answer is... Huwag kayo mag-alala. Hindi ko naman lagi pinipili yung last. Sige. Make sure when you answer, you know why, ha? Yeah, because you remember last week. Diba? We've established when I ask a question, you have to not, especially when the choices are there, okay? You have to know why. Okay? All right. So 5, 4, 3, 2, 1. It's the last one. Okay? Let's go with numbers generator. Renmar, no. My moderator is not involved in any of this crap. Mr. Moderator, give me a number. 13. Lucky number 13. Let's see. Not enough people answered actually for now. Oh, no, a lot of people actually answered. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Laika, 10, 11, 12, 13. Oh, I've never seen this person speak. Earl Justine Pejo. Is Earl Justine Pejo there? Oh, I thought that was a guy. I'm sorry if I assumed you're a guy because the name is a guy's name. But anyways, hi Earl. Why did you answer true? Does the body really protect itself because it releases hepcidin? Why? What is your thought on that one? Why did you answer true? Girl, you're just repeating what I just said. You're playing with Batam. Girl, you just repeated what I just said, but only in Tagalog. Um, give me another one, Marion. Eight. So from Earl, one, two, three, four, five, six, seven, eight. Roddy May Samonte. Roddy May Samonte. You answered true. Why did you answer true? One way the body protects itself is by releasing hepcidin. Roddy May Samonte. Wala. Absent or hindi nagsasalita? You can say you don't know the answer. Don't worry. I'm not gonna use it against you. Don't worry. If you don't know the answer, it could be instead of us waiting. Don't worry, guys. By the way, for future reference, if you don't know the answer, just say, "Sir, I don't know the answer," and don't worry. It's not gonna be used against you. Recitations are not graded in my class. It's the effort that counts. Who raised their hand? Kim Kylie. Kim Kylie. Oh, sige, go. Metabolism, by the way, not hemostasis. Metabolism. Iron metabolism. Okay. Oh, how is it the body? How does that protect the body? 'Di ba nga kailangan natin ng iron? Okay. But that is more on iron metabolism, not positive and feedback mechanisms, not more on the body's way of protecting itself. But yeah, thank you for answering. Next answer. Let's go back. Let's go. Patrick, kakasabi ko lang kanina actually if you were listening, if you guys were listening, you would have gotten the answer earlier. Sige, Patrick. Pakitaan mo sila, Patrick. Charing. Pag ano muna, wait, pag ano ng iron? Absorb, 'di ba? Pag absorb. Okay. All right. Not really utilizing, more on metabolism. But thank you. That is the answer that I was looking for. Thank you. Remember earlier I mentioned, thank you, Patrick. Um, remember, please add 1 point, Marion, to Patrick. He was the only one who actually got it. Yeah. It prevents the metabolism of some microorganisms cannot complete its not really metabolism. Some bacterial metabolic pathways could be impeded because of lack of iron, and one of and the body, as I've told you guys before earlier, is that the body is designed in such a way that infection is infection is confused with inflammation, 'di ba? 'Di ba sinabi ko kanina 'yarn? 'Di ba? Kahit wala kang inflammation, kaya ka nagkakaroon ng anemia. Pero in the case of protection, yes, it's true. Because some microorganisms utilizes iron for their metabolic pathways. It cannot and since the body recognizes infection, has a certain way of recognizing infection, it will release hepcidin to protect itself. Okay? With the expense, of course, of the host. Yun nga lang, kasama ka kasi magkaka-anemia ka eh. Especially if it's chronic. 'Di ba? Okay? Clear? Clear kung paano nang poprotect ang katawan with hepcidin? Class? Clear ba? Hindi clear. Okay, clear kay ano, kay Patrick lang. Kay Patrick lang. Sa'yo, Mel, clear? Okay, clear daw kay Mel. Alright, let's move on to the next one. ADA versus anemia of chronic disease. IDA versus anemia of chronic disease. All right, so we're going to talk about IDA versus anemia of chronic disease. I think we have to look at the chemistries first. What are the chemistries before we go to the next slide, Moyo? I want people to remember what are the chemistries that we need to know when we're differentiating microcytic hypochromic anemias. Ano nga 'yon kanina? Kanina natin yun ano, Kim, kanina, sumagot ka nun kanina, Kim. What are the chemistries that we need to look at when we're differentiating macrocytic hypochromic anemias? Transferring through the use of through the measurement through by measuring what? Very good. Well, okay. Serum iron, you forgot serum iron. All right. Anyways, thank you so much. You at least there's some things there that stuck. All right. Let's show them Moya the difference between the two. All right. So, anemia of chronic disease versus iron deficiency anemia versus anemia of chronic disease. Serum iron is both decreased in both instances. Why? Because hepcidin in anemia of chronic disease is released. Therefore, absorption of iron is what is impeded. Therefore, serum iron is low in the serum. Percent saturation is basically the same thing. Percent saturation of what, sir? Percent saturation of iron. All right? And saturation of oxygen. What? Why? The only reason why oxygen is in our system is because of the iron molecules. Specifically, what iron molecules? Ferrous or ferric? Ferric, di ba? Right? Mabilis ba, class? Mabilis? Bahala kayo dyan. Now, the only difference, the only thing that will differentiate it is TIBC and ferritin. Well, in TIBC, while the TIBC of IDA is increased, for anemia of chronic disease, it's increased. Okay? Ferritin, on the other hand, is the opposite. Okay? Ferritin, on the other hand, is the opposite. Clear? Pa? Kaya nga sabi ko sa inyo kanina, kung meron man kayong aalalahanin, IDA. Kasi, siya lang ang merong ganun. Okay? For complete reference, you could put a star on this one. I don't care how you do it. You can copy it in a post-it note, paste it, stick that post-it note in front of your bed. When you wake up, you'll remember, oh my gosh, IDA, increased the IBC, decreased ferritin. O, diba? Para hindi nyo makakalimutan. Also, don't forget, serum iron. Now, how is IDA different from sideroblastic anemia? Sige nga. Using the same parameters. Bumalik tayo kasi sabi ko, tatanong ko nasaan na mga Junakis ko? Nasaan na, ayan, na si Kim Kylie, pumapalag si Kim Kylie. Sige, hindi na pala ako mananawag. Sige, pumapalag si Kim Kylie. Pakitaan mo sila, Kim Kylie. Parehong low? Parehong low ang what? Parehong, ang... Hoy! Hoy, hoy, hoy. Hoy. Serum iron lang ang pinagkaiba nila, 'di ba? Remember that what in sideroblastic anemia, iron metabolism specifically what the heme molecule is impeded. 'Di ba nga kanina ginamit ko pang example si Sino ginamit ko example? Kanino ko pinaalala kanina? Kay Leila, 'di ba? Leila, kinig tayo dito, Leila ha. Ang tatandaan mo lang kapag may kulang na enzymes, hindi ka makakaproduce ng heme molecule, 'di ba? So, increased serum iron, TIBC is decreased, ferritin is decreased because there's nothing to absorb, right? There's nothing to transport. Ferritin is increased. Magbabaliktad, 'di ba? Nakita niyo yung nakita niyo yung nangyayari, 'di ba? Madaming iron eh. Ibig sabihin yung ferritin may increase. 'Di ba? Madaming iron na nagsi-circulate. Clear ba? Naintindihan mo kung bakit kung bakit madaming nai-store. Ferritin is the storage form. TIBC or transferrin in this case is the transport molecule. There's nothing to transport but a lot to be stored. 'Di ba? Clear? Clear? When there's nothing to store, ferritin is increased because what? Ferritin is increased because the body compensates production by storing more iron molecules. Kasi nga, erythropoiesis. Magpuproduce siya na magpuproduce ng RBC. Kasi nga oxygen saturation, kaya nga nilagay ko diyan yung oxygen saturation, 'di ba? Oh, 'di ba? Okay? Clear ba, guys? Klaro ba, guys? Pag may hindi naintindihan, pwedeng itanong sa akin. I will take the time to answer questions. Huwag kayong mag-alala. Okay? Next slide, please. Ikaw, Moyo, naintindihan ba, Moyo? Klaro naman. Okay. Siyempre, ikaw yung may advanced copies eh. Alright. Normocytic anemia naman tayo. Hoy, advanced copies lang ng lecture niya, hindi advanced copy ng exam mo ha. You might be confusing being a moderator with ano ha, with an actual with a teaching assistant ha. A teaching assistant is different. Alright. Normocytic normochromic anemias naman tayo or normocytic anemias in general. Alright. So when you say normocytic anemias, these cells are what? The cells are of normal size and of normal chromacity. When I say chromacity, the hemoglobin content is okay. Or when you look at it in the peripheral blood smear, it looks the same. Or it looks normal. Okay? Now, let's talk about one of the most common ones that is discussed in the exams. It's paroxysmal nocturnal hemoglobinuria. Okay? Paroxysmal nocturnal hemoglobinuria, also known as PNH. PNH, all right? The major defect in paroxysmal hemoglobin, I think that's the next slide, Moyo. The major defect in PNH is what? The PIGA gene, PIGA gene, phosphatidyl inositol glycan A or glycan class A. Okay? Phosphatidyl inositol glycan A. Okay? Sir, kailangan naming alalahanin. Paiga lang alalahanin nyo. Huwag kayong mag-alala. Sa mga exams, hindi yun na ano. Okay? Phosphatidyl inositol glycan A. Gusto ko lang sabihin phosphatidyl glycan class A lang. Okay? All right. So the importance, what is the importance of the defect in the gene in PNH? PIGA gene helps in coding for the decay associating factor and the MAC inhibitory complex, inhibitory protein. So ano naman problema? Anong pakialam natin, sir? Anong problema niyan? Remember that the inhibitory complex and the decay accelerating factor stops complements from activating. It's a regulatory mechanism, 'di ba? Naalala niyo yung complement cascade natin, 'di ba? We talked about the alternative pathway, the classical pathway, and then the mannose banding lectin pathway. It's all coming back together now, 'di ba? Kaya ang ganda ng start ng discussion natin because we started with immunology, 'di ba? So that you guys can understand what is going on with the body, 'di ba? Ang galing ni Sir Marco, ang galing niya. Inuna niya ang ano. Because if we discuss this without forehand knowledge of immunology, you won't understand what is the the importance of DAF and MIP or MAC inhibitory protein is for. So DAF and MAC inhibitory protein, they prevent the action of what? Complement fixation, the what do you call this? The pore formation, yung membrane attack complex kumbaga, 'di ba? So if there is unregulated membrane attack complex formation, okay? If there's unregulated membrane attack complex formation, there is hemolysis, 'di ba? 'Di ba? Clear? There is hemolysis. Kaya nga pag sinabi nating normocytic normochromic anemia, most of the time we're talking about hemolytic anemias. Okay? Clear? Clear ba kayo? Pag sinabi natin most of the time, not all the time, pero most of the questions that you'll see when the blood picture is normocytic normochromic, always assume, ang una nyong i-assume, hemolytic anemia to, sir. Alam ko na. Okay? Or baka hemolytic anemia. Now, let's talk about it more. Okay? Laboratory findings naman tayo. Laboratory findings are essential. What laboratory findings are essential for patients with PNH? You'll see a negative Coombs test. Okay? Pancytopenia. Okay? What is pancytopenia? By the way, pancytopenia is decrease in what? What is pancytopenia? Pili ka ulit ng number, Moyo. 18. Mamili tayo from the class 1. Skip tayo kay microflores. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Ay, may nagtaas ng kamay. Taray na Squid Game talaga natin. Andrea, sige, ikaw na unahan mo na paraan. What's pancytopenia? Very good. Okay. Very good, very good. Pancytopenia is decreased. Pan meaning all, cyto meaning cell, penya meaning low. 'Di ba? Iniisa-isa ko na. Tinuturuan ko na din kayo ng Latin. Diba? Taray naman ang klase na to. Akala ko ba, sir, hematology lang? Bakit may Latin? Alright? What is Coombs test nga ulit? Another term for Coombs test? Pinag-usapan na din natin yan. Blood banking review and immunology and serology review. What is Coombs test? Nako, kalimutan na nila. Oh, ayan na ay. Ang Junakis, pakitaan mo sila. Pakita mo sa kanila na smart ka na, pretty ka pa. Very good, very good. Okay, so in general, just for the sake of review, Coombs test basically you're using anti-human globulin as your reagent, right? You want to detect what? Coombs test what are we detecting? Direct or indirect Coombs test? Basically, if it's hemolytic anemia, we're using direct Coombs test because you are detecting sensitization in vitro or in vivo? In vitro. Kasi nga, kumuha ka ng cells, tapos iti-test mo. Lalagay ka lang ng anti-human globulin, di ba? Tinitingnan natin kung nakakabit ba yung antibodies, di ba? Kaya negative siya. Di ba? Kaya negative. Kasi ang problema is yung PIGA gene eh. Wala naman ako sinabi kanina, di ba, na autoimmune antibodies against RBCs. Meron ba ako sinabi kanina? Di ba ang problema is PIGA gene? Di ba? Clear? Kung bakit negative ang Coombs test niya? Kasi wala namang autoimmunity. Ang problem is the PIGA gene which is responsible for producing DAF and membrane attack complex inhibitory protein or the MIP. Okay? Clear? Clear ba kung bakit negative ang Coombs test? Now, we move on to the normocytic normochromic blood picture. There's nothing wrong. There's no abnormalities in the serum levels of iron. Hindi siya nasaksak or anything, but there's still anemia. Okay? There's still anemia. So that explains the findings. Okay? All right, let's move on to the next one. What test is traditionally used to test for PNH? Traditionally, we use Ham's acidified serum test, or we use sugar water test or sucrose lysis test, sucrose hemolysis test. Ham's acidified serum test, basically you acidify the serum that activates the complements. Sugar water test binds to the molecules, binds to the surface of in the sugar water test, but that's the reason why I call it traditional screening tests for PNH. It's because it's no longer used in the laboratory because we have molecular studies na eh. Diba? And other genetic studies that can determine what is the type of anemia. But to give you a brief description, a brief understanding, you add sucrose. Sucrose is a sugar, and MBL pathway could be activated there. Okay, if there's no lysis, that is a positive result. If there is lysis, that is a positive result. Sorry. Okay. So what you do with these two tests is you induce lysis by activating the complements present in the patient's serum. Alright? Clear? Clear ba? Clear? Yun yung basic principle niya. Walang nag-clear, so ibig sabihin hindi nila ano. Okay? Now, since we're talking about Ham's acidified serum test, we need to talk about the acid that we use for Ham's acidified Ham's acidified serum test. Acid that we use is a dilute solution of hydrochloric acid at around 0.02% of hydrochloric acid. That's the thing that you need to remember. I'm not sure if they still ask these questions, but the latest version of Henry still indicates it as such. So kailangan na pa rin nating alalahanin. Alright? Now, today, PNH is diagnosed using flow cytometry. Okay? Flow cytometry. What do we target? The cluster of differentiation. Okay? Cluster of differentiation, specifically CD55 and CD59 in RBCs. Kita nyo kung paano na natin i-identify. Mas klaro siya kasi acidifying a serum could result a positive result in Ham's acidified serum test could be a result of some underlying condition. 'Diba? At least here we know that the problem is the piga gene because the piga gene codes for CD55 and CD59. If it's absent in the cells, it means that there is a defect in the piga gene. All right? Now, next question. Right. True or false? PNH is a form of hemolytic anemia that occurs at night. Sige nga. True or false tayo nga. Let's see the answer. I need answers from people. And I think the reason you guys have an attendance with Sir Marco is because if he sees you answering the questions here. So let's see. Okay, there's a mixed bag of answers. People are saying false, but Renmar is saying true. Okay? Let's see if Renmar is true. Let's see if the majority is all right. Still, a lot of people are answering false. Mel also answered false. He's a groupmate of yours. Bike answered very sternly with an all caps of FA. Okay. Okay. Claire Gono also answered. All right. Let's stop with Ari and Dorothy. Okay? Let's start with Ari and with Kim. All right. Give me a number then, Marcos. You're the only one who answered false. You're the only one who answered true. Give me a number. 10. All right. So starting at the back, asking. I'll start asking. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It fell on Angelo Cunanan. Angelo Cunanan, where are you? Pakigalaw ang baso, Angelo. Hi, Angelo. Angelo, why did you answer true? Why did you answer false? Go on, don't worry. Very good. Very good. Very good. Very good. Very good. Very good. Okay, very good. So yeah, that's a historical misnomer. Actually, it's now known as piga gene hemoglobinuria, piga gene deficiency hemoglobinuria. If you look at the recent studies right now, it's no longer So hemoglobinuria, nocturnal hemoglobinuria is used the term when the knowledge of complements were still unknown to physicians in 1882. Okay, in fact, hemolytic crisis can occur at any time of the day. So Angelo is correct. Very good. Pakibigyan nga natin ng plus one yan. Ay, ng points yan si ano. Points lang ha, hindi yun plus one, Angelo ha. Pakipalakpakan din. Yes, it is a misnomer. Nasaan si Segi? Hindi ko nakikita yung kabromance ni ano. Kaya pala parang malungkot si ano, si Patrick. Nasaan si Segi? Wala si Segi ngayon ha. Anyways, thank you so much for that. Thank you so much for that answer. It made my day, Angelo, because it means to say that you are understanding you have a good understanding of PNH, which I will ask you again later. Okay, let's see if the knowledge sticks. All right, now let's move on to the next slide, and I think we're talking about G6PD deficiency. Right, G6PD deficiency is what? Is a major cause of patients in what a major cause of anemia in patients with what is the major let's talk about it in terms of symptomology. This is because of oxidative stress from free radicals. Okay. Basically, G6PD is a way of RBCs of surviving without what remember, what is the normal lifespan of RBCs, by the way? Just for a review. Kim. Si Kim. Mamaya ka na, Angelo. Grabe ka naman, Angelo. Si Kim. Kasi ikaw yung nasa una. Walang ibang reason kasi ikaw lang yung nasa una na picture. What's the, ano, what's the normal lifespan of RBCs? 120 days, or you can say 110 to 130 days, depends on the book that you're using. I could have accepted 110 for all I care. Anyways, you're correct. It's basically 100 days. So oxidative stress occurs in this 100 days, of course, right? um Oxidative stress is from, I think, formation of free radicals. And G6PD, if in a normal, right now Renmar is still alive and he's not suffering from any form of do you have any form of redness anywhere in your body that seems unusual, Renmar? Nothing, right? So right now, I could assume, and he survived without anti free radical medications. So I'm assuming he doesn't have G6PD deficiency. So um right now he has G6PD. So the normal function of G6PD is to remove the free radicals in the RBCs. Okay? So that it be able to survive. Okay? Normal levels of that one remain stable. The G6PD remains stable for about 90 days in the outside of the blood, the bone marrow rather. Okay? So the removal, if for example you are G6PD deficient, it's easy for the cells, or to be specific, the RBCs, to be lysed by oxidative stress. So ano ba ang nagko-cause ng oxidative stress natin? Eating what? Eating faba beans. If you have a boyfriend, Renmar, from Italy or from Greece, he might have given you faba beans. Okay, as a native staple food there in there, as a staple food there in Greece, particularly in Mykonos. 'Di ba? Taray Mykonos to. Dinala na si Redmar sa Mykonos. 'Di ba? If you have a boyfriend there. Okay. What else is there? Inhalation of those little, those little balls that they put in your cabinets there in the Philippines? Yung mothballs, they're made of naphthalene, right? When you smell naphthalene, it can actually cause oxidative stress. Okay? So, by introducing free radicals in your system. Okay? So that's a way for the body. That's the normal way how the body does it. If you don't have G6PD deficiency, you can still survive without suffering from a hemolytic crisis. But because we're talking about the G6PD, because we're talking about hemolytic anemia caused by G6PD deficiency, we're going to talk about the next slide na. Kasi nandun na yung next na question natin. We're talking about the biochemical pathway. Alright? So the biochemical pathway for that one is the hexose monophosphate shunt pathway, which has something to do with the metabolism of glutathione. Sir, talaga pala, glutathione? Yes, nag-take ako niyan nung nagaling ako ng Pilipinas, but not because of whitening reasons. I'm loving the color of my skin. Kasi naiinggit yung mga kaibigan ko, mga puti sa akin, maganda daw ang skin ko. Kasi tan tayo. Sila they can only dream of a tan skin in their dreams unless they expose themselves to the UV rays of during summertime. But suffice it to say, glutathione is important in my case because I have a problem with my liver. Okay? Glutathione. No, I take glutathione for my fatty liver. Okay? So, huwag kayong dyan. Hindi nagpapaputi si Sir Manuel. Side effect lang yung pagpapaputi. Okay? Anyways, the hexose monophosphate shunt. Let me show you guys what is the hexose monophosphate shunt. Please show it to them. So, glutathione is the molecule that reacts with NADPH. Glutathione will be reduced by NADPH by glucose 6 phosphate dehydrogenase. It hydrolyzes the hydrogen molecule, and thus getting a reduced form of glutathione. All right? The reduced glutathione binds to free radicals. That's the reason why we take in glutathione. Kaya nga naririnig ninyo 'di ba sa commercials, take na tayo ng glutathione, puputi ka na at wala ka pang free radicals, hindi ka tatanda, 'di ba? Kasi in the case of the body as a whole, free radicals ages us faster. Okay? It ages us faster. When you talk to a dermatologist, they hate free radicals. Okay? Kaya nga nag-ano sila nung glutathione drip ngayon. Isa sa mga ino-offer nilang services yan, yung glutathione drip na yan. Okay? But in the case of RBCs, free radicals accumulate in the human body because there's no reduced glutathione circulating in the system to bind with them. All right? And thus resulting to G6PD deficiency induced hemolysis. Okay? Kasi wala yung control mechanism na yon. Okay? Clear ba sa lahat? Wala kang G6PD, NADPH binds to NADPH becomes NAD, just circulates, and it won't react to glutathione to form reduced glutathione, which can bind to free radicals. Okay? Madami yung listahan ng free radicals na yun, and I don't think we're going to study dermatology naman, di ba? Medtech ang tatapusin natin, di ba? Hindi naman tayo magiging dermatology technician or aestheticians at ang tawag dyan sa Pilipinas. Anyways, let's move on to true or false question. True or false? People with G6PD deficiencies can't live normal lives. Nako. Imaginein mo na lang yung analogy ko kanina sa iyo, Renmar, ha? People with G6PD deficiencies can't live normal lives. True or false? Again, you have to explain yourselves, okay? Sige. False, 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 false. Everybody said false. Walang magsabi ng true. Okay? Okay. 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 Done with that. Okay. Gracie Hanagas is the last one. All right. Let's start with Angelo. Angelo, select a number from 1 to 10. 4. So 4 above Angelo. 4 numbers above Angelo. 1, 2, 3, 4. Mel. Mel Dominic Bernal. Where's Mel Dominic Bernal? I think I saw him earlier, but he's not appearing here in our class anymore. Mel, are you there? Alright, Mel, why did you answer false? Kasi sabi ni Angelo false? Or sabi ni Bai false? Ganun ba? I would assume that if you don't know, if you can't answer my question. So Mel, why did you answer false? They can't live normal lives? Mm-hmm. You playing with my time. Alright. Ano? Alright, ayan na si Jovel. Tulungan ka na rin, Jovel. Inulit mo lang yung chart natin, Vel, eh. Ikaw naman, Vel, inulit mo lang yung chart natin, eh. Okay, Jomel. Jomel, explain to me why you answered false. Did you answer, Jomel? I didn't see you answer. Oh yeah, I answered. Okay, explain to me why they can live normal lives. Okay. Okay. Ano ang as long as okay, 'di ba? O 'di ba? Ganon. Just avoid oxidative stress. Yun nga yung sabi ko kanina, 'di ba, Renmar? Yung jowa mo from Mykonos, binigyan ka ng faba beans, 'di ba? Avoid mo lang 'yon kung may G6PD deficiency ka. Meron akong katrabaho na Pilipino nung nagka-work ako sa Saudi Arabia. Wala namang faba beans sa Pilipinas, 'di ba? So hindi natin alam kung meron siyang G6PD deficiency. Nung pumunta siya ng Saudi, sabi niya, "Uy, narinig ko to dun sa hematology class natin." Tinikman niya. So nung kumain siya biglang nagulat na lang kami, bigla siyang red all over. Tapos yung wiwi niya, Yung wiwi niya nag-darken daw. Bigla siyang bigla siyang naluka siya. Hindi niya alam kasi she wasn't tested with what? With how do we test for G6PD deficiencies? Yung newborn screening, 'di ba? 'Di ba? Tinitest yan using newborn screening para malaman kung ano yung i-avoid as Jomel said earlier. Alright? So, avoid lang natin yung faba beans kung may ano ka. Or test natin kung meron kang G6PD deficiency because I think when we study medtech laws, you will know the reason why some people haven't been tested with G6PD deficiency. Okay? All right? Babalikan ko yung date kasi nakalimutan ko na yung date eh. Okay? Anyways, let's move on to the next slide. All right. Now, what drugs can cause hemolytic crisis in patients with G6PD deficiencies? I think you just need to remember the mnemonic that I gave you guys. D6P. 'Di ba? D6P naman siya. Binaliktad ko lang yung D6P. It's all in the letters there. It's all in the acronym there. Just remember it's all in the acronym D6P. Anong ibig sabihin ng D6P? Dapsone, sulfa drugs, and primaquine. Ano yung primaquine, sir? Huwag mo kakalimutan. That is for malaria. 'Di ba? When you were listening, if you listen to your to the discussion for Plasmodium species, you would know that primaquine is the drug of choice for most patients in who are suffering from malaria or who are taking malaria prophylaxis. Okay? Yung mga magpupunta ng dyan, ng Palawan, okay? Nakapunta ka na ng Palawan, Renmar? Oy, pag nakauwi ako ha, give me your number. I will bring you there. You will find a lot of apam, okay? Dadalhin ko si Alex. Okay? Papakilala kita kay Alex. Okay? Alright. Anyways, tama na yung pambubugaw natin. Let's move on to the next slide. What's our next slide? Trivia. What types of beans? I think we've already answered this one. This is faba beans. And I think you'll see a picture of faba beans para alam nyo na kung ano yung avoid ninyo. Alright? You have the fresh version, the dried version, the fried version, and the I think the pickled version. Okay? Alam nyo na kung anong i-avoid ng kaibigan mo, Jomel, ha? Baka may magregalo ng faba beans. Okay? Pakita mo na sa kanya yung picture na yan. Yan yung pinili kong picture para nandyan kasi yung mga versions eh, yung fresh, yung pickled, yung sun-dried, yung mga ganon, at saka yung inadobo. Okay? Yung inadobong version yan. Alright? Next, let's move on to the next slide. Denatured hemoglobin from oxidative stress results in what inclusion bodies? Huwag mo kakalimutan yung nag-imbento ng tomato sauce. Heinz, 'di ba? Heinz bodies siya. Huwag mo kakalimutan. Hemoglobin pag hemoglobin H, okay? Ano yung shortcut natin pag DNA naman? Ano naman pag DNA? Jolly D, 'di ba? Howell Jolly bodies, 'di ba? Para hindi niyo makakalimutan. Hemoglobin yan, sir. Heinz bodies yan. Para hindi niyo makalimutan ma-confuse with Howell Jolly, tandaan niyo lang Jolly D. Kasi diyan ako nalilito ng estudyante ako yung Heinz at saka yung Howell Jolly kasi majority of the questions that you'll be encountering the board exams will be in written form. Okay? Saka pa lang natin ma-appreciate yung pinakikita sa atin ng mga slides ng ating mga professors diyan sa CMCC, CMCC pag nag-take na kayo ng ASCP. Anyways, let's move on to the next one. Laboratory findings in patients with G6PD deficiencies. Obviously, you're going to see what? Wag muna natin pakita. Okay? Muna natin pakita. Negative Coombs test. Bakit? Kasi wala namang in vivo sensitization, right? There's nothing wrong with the immune system of that patient. Or there's nothing wrong in the patient's plasma that could be attacking the cells. You're going to see normocytic normochromic anemia and the peripheral blood smear along with what? Along with Heinz bodies, kakasabi ko lang, and bite cells. Saan nanggagaling ang bite cells? Bakit tayo nagkakaroon ng bite cells? Remember our discussion with the spleen? What is the action of the spleen? Si Patrick ang sagot nun, tas palakpak ng palakpak si Segi eh. What is the function of the spleen? Patrick. Hindi ko makakalimutan yun na si Patrick ang nakakasagot nun eh. Patrick, what is the function of the spleen? Or kung sino man, please raise your hand if you remember. Renmar. Wala na si Renmar na. Ayoko na. Tampo na ako. Very good. So pitting is what we're talking about. Pitting basically is the removal of inclusion bodies. Yeah. So in that process, you produce blood. When you're removing inclusion bodies, you chip off a bit of the what the phagocytes chip off a bit of the blood cell. The normal morphology is then reduced to a bite cell. Yung parang kinagatan na donut. Okay? All right? Clear? Clear kung bakit nagkakaroon ng bite cells? Alright. Let's move on to the next slide, which basically explains the things that I've said. Normocytic normochromic anemia, Heinz bodies on peripheral blood smear, bite cells on peripheral blood smear, and the most important thing of all is that it's a negative Coombs test, which means it's not an autoimmune disorder. Okay? Now, let's move on to the next one. I think this is trivia for those people who are going to study for parasitology. Also, you might have an appreciation of this question. Patients with G6PD deficiencies have been known to have a certain level of resistance to what parasite? Kakasabi ko lang kanina din nun. Ay, nako, kakasabi ko lang. Parang 5 minutes ago lang. Patrick! Very good. Very good, very good, very good. Okay, now let's talk about something else. I'm tired of G6PD deficiencies and PNH. Let's talk about hereditary spherocytosis. Okay, hereditary spherocytosis is quite special because it doesn't belong to the autoimmune group of normocytic normochromic anemias, but there is a certain change in its morphology. Okay, it can be sometimes considered as hyperchromic anemia. I'll tell you guys why. All right, let's move to the first slide. What abnormality is present in patients with hereditary spherocytosis? Well, basically, it is an abnormality with dysfunctional RBC skeletal proteins. Okay? What are those RBC skeletal proteins that I'm talking about? There are three of them. There are three of them that you need to remember. Okay? I think that's on the next slide, right? Okay, what are the examples of these of RBC skeletal proteins? When I mean skeletal proteins, it's the one that makes it look like a biconcave disc. Okay? Walang skeleton ang ano ha. Walang skeleton. Guys ha, wag kayong ano ha. Pag binago ko yung question, pag inano ko lang siya, pag sinabi ko what makes the RBC have its shape, wag yung sasagot skeleton ha. The skeleton of the RBC is because there is a skeleton for the RBC. No, it's skeletal proteins. It's basically my analogy for this one is like when you're making a bridge, right? Have you guys seen San Juanico Bridge? Right? San Juanico Bridge has like those iron or steel bars connecting to it in a triangle pattern. So that's basically what these three proteins are doing. Ankyrin, spectrin, and the bands. There's two types of bands, by the way. I forgot to write it there. Can you show them the next slide? Okay, so spectrin, ankyrin, and bands. Bands one, two, and bands one and two. Okay, but what happens to the RBC shape when there is a I think that's the next slide. What happens to the RBC shape in cases of hereditary spherocytosis? It becomes a what? Andrea. Alright. Hindi nawawala ang central pallor. Ikaw naman. Nawawala yung biconcavity. 'Di ba? The biconcavity causes the central pallor. Ikaw talaga. Okay? Nawawala ang central pallor. Hala. Bumaba ang, tumaas ang ano, tumaas ang hemoglobin content kung ganon. No. Yung biconcavity ang nawawala. Parang lumolobo siya. Think of it as like a balloon. Alright? That's what happens to it. Okay? Alright. Now, spherocytes are often lodged in organs like what? Ayan na naman tayo. Alam na alam ni Patrick yan. Alam na alam ni Patrick yan. Pustahan tayo, alam ni Patrick yan. Saan, Patrick? O, taray, tingnan nga natin kung tama si Patrick. Taray ni Patrick. O, di ba, Patrick? Patrick, kanina, nung isang linggo ko pa napapansin, yung mga madadaling questions, yung mga nasasagot mo, ha? Niloloko mo ako, ha? Master of the spleen ka, ha? Puro spleen ang mga sagot mo. All right. Next slide, please. Okay. Now, what are the usual laboratory findings of patients with hereditary spherocytosis? Meron na ba siyang ano? Meron na siyang do you think that this patient will have a positive Coombs test? Ay, tumatango si Jomel. Sige nga, Jomel, bakit? Jomel, why? Jomel. Kasi, kasi nga, anong problema niya? Anong problema ng pasyente? Okay, so hindi siya autoimmune pa rin, di ba? Okay, very good. So, sa skeletal protein. Pinaulit ko lang kay Jomel. Tinignan ko lang kung nakikinig sa akin si Jomel. Nakikinig naman. In fairness naman kay Jomel. Pakipalakpakan na. Pakibigyan naman ng heart si Jomel. Guys. Heart, guys. Ano ba? Patrick, ha? Yung kamay mo, ha? Bagay na bagay sa kanya. Alright. Hindi ko pa nakikita si Dexter. Nasaan na si Dexter? Parang hindi ko pa nakikita si Dexter today. Alright, so... Ay, nandyan ka, Dexter. Buhay ka pa ba, Dexter? Okay. Kung sino-sino na yung mga nakikita ko, hindi ka nagpaparamdam, Dexter, ha? Alright, so... Let's see the findings. Okay. So patients with hereditary spherocytosis, they have a negative Coombs tests. They have microcytic hyperchromic anemia. Kita nyo? Kasi nga nawala yun. As who was that girl again? Andrea what said earlier, that patient the cells loses its central pallor, not because there's an increase in globulin, not because there's an increase in hemoglobin, but because the skeletal proteins do not permit the biconcave shape. Okay, there's Howell Jolly bodies because skeletal proteins the skeletal proteins have residual DNA in them, and there's bilirubinemia because there's just not enough there's just too much RBCs that are being destroyed. Okay, intravascular hemolysis, if I may be so specific. Anyways, now what is the reason why Howell Jolly bodies are present in hereditary spherocytosis? Altered macrophages, basically the inclusion bodies cannot remove it. Okay, because they're attached to the skeletal proteins, and because there's no skeletal proteins, it's just stuck in the cell membrane, right? That's what I said earlier. All right. Now, let's talk about the gold standard for the diagnosis of hereditary spherocytosis. Please don't forget about what? What test do we use for? Ayan yung maraming test tubes. Meron bang nag-intern na dito na pinagawa ng ganyang test? Wala. Ala, ano na nangyari sa quality ng ating medical laboratories dyan sa Pilipinas kung hindi kayo pinagawa? Kasi nung estudyante ako, pinagawa pa ako niyan. 2011 lang ako naging intern, ha. Hindi pa ako ganoon katanda, class. Grabe kayo. Maski dito sa US, ginagawa pa rin yan, pero automated na. Sino dito ang pinagawa na ng test na yan? Marami yan tubes. Wala. Walang nakakaalala kung ano ang test. Very good. Osmotic fragility. 'Di ba? All right. Patingin nga kung tama ba si James Paul. James Paul, bakit hindi ka nag-raise ng hand? Nagsagot ka lang, James Paul. Grabe ka, James Paul, ha? Nakalimutan mo na yung ano natin, ha? Yung rule natin, yung house rules natin. When you answer, you're supposed to raise your hand and then unmute yourself once you're called. Ayan. Huli na lahat, James Paul. Huli na lahat. Nakakaloka ka. Alright. Next slide na tayo. Next slide. Alright. There are two methods for osmotic fragility. We use the Sanford method or the Dacey's method. Sanford method is mostly on visual inspection, while the Dacey's method is more on spectrophotometric. This is usually applied. The Dacey's method, you could add one there, is usually applied in automated analyzers right now. Okay, so we have that. I asked the people in the core lab if they have that. If they have a spectrophotometric analyzer for osmotic fragility, and they have, it's gathering a lot of dust because it's not a common test in the clinical lab. It's just something that they use when a patient has a diagnosis of anemia of unknown origin. Meron ba kayong nakita na ganun doon sa mga nag-intern? Diagnosis ng mga internal medicine doctors natin, particularly mga residents. Anemia of unknown origin. Yun yung diagnosis nila. Wala pa. Wala pa kayong nakitang ganon. Kasi battery of tests yan eh. Ang unang-unang itetest dyan is PBS, di ba? Ay, CBC of course pala. CBC. PBS or peripheral blood smear. Other than, aside from that is Coombs test. May ESR pa yan para lang malaman kung malalaki ba ang cells or mabibigat ang cells. Ganon. Tapos kasama pa ang osmotic fragility. At isa ako sa mga malas na student, na toxic na students noon, nung time na yon, na timing sa patient na may anemia of unknown origin. Okay? Kasi may battery of, kasi nga dadaling ka sa battery of tests na yan. Okay? I've never seen anybody with hereditary spherocytosis in my life because it occurs 1 out of 100,000. Okay? Just for your information. Okay? Let's go with the next slide. Let's interpret the results for Sanford method. This is usually the question that is going to be asked in your board exams. Okay? I don't think I put an answer to that one. Basically, when you're using when you're answering when you're resulting a result when you're resulting OFT, you you're going to start with what? An isotonic solution, right? What's an isotonic solution again, Dexter? Kasi na-miss ko si Dexter, hindi nagsasalita si Dexter ngayon eh. Busy ba because of thesis? Or what? Okay. So, what is an isotonic solution that we use for OFT? James Paul. Ayan na si James Paul. Masunuri na si James Paul sa ano, sa house rules. Okay, James Paul. Ano? NSS. Normal saline solution. Ang arte ng mga tao dito, saline daw. Pagdating ko dito, saline din ang gamit ko na. Normal saline solution daw, according to James Paul. That is correct. And we start with what? If you have a hypertonic solution that is going to be more than you start with the middle part. Basically, I'm going to start presenting, and Moyo, please put that one because there's no answer to that one. Okay, so let's go to the next slide so I remember what my next question would be. What type of sample? Okay, so I'm going to be presenting next. I think I'm still in the class. I'm sure. Yeah, I am. All right. Okay, so I'm gonna boot off Marion. Okay. Okay. Now I'll have a survey for my students here. Let me just check if I'm broadcasting. Okay, so I'm broadcasting now. Okay, so osmotic fragility test. Let's use a red one because we're hematology. Okay, so you have tubes here with decreasing tonicity. So when you say decreasing tonicity, lower than what? Lower than normal saline. Okay, you use a normal saline solution. So about point. What happened to my? About 0.85% NaCl. Okay. Now, I want to see if you still remember which one is. So this is hypotonic, and this one is hypertonic. Okay? Meaning that the salt solution increases 8.88, 8.85, blah, blah, blah for hypertonic, 8.80, 8.87, or 8.70, blah, 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 blah. Okay? So, a person with hereditary spherocytosis will be what? Hypertonic or hypotonic? Who here will be able to answer that question? No, not who here. I'll give you guys time to answer. Your choices are hypo or hyper. If your patient has if your patient has hereditary spherocytosis, his blood will lyse, his or her blood. Or let's say, for example, Jomel. Jomel, I'll use you as my example for today, okay? All right. I hope you don't mind because you've seen my previous lectures, right? I use a lot of people. Okay? So Jomel has hereditary spherocytosis. Which direction do you think his blood will begin to lyse? In the to the left side, to the left, to the left, sorry, to the right side, to the right, or to the left, to the left. Everything you own in the box to the left. Charet! Charet lang. Charet lang. Walang ganon. Okay? Nag-aaral tayo dito. Ano? Answers, class? Answers? Hypo daw. Hypo. 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 Hypotonic daw. Okay. Osmotic fragility. Okay. Remember the terms. Osmotic fragility. Hypo ang sagot ng mga Otauchi. Okay. Nasaan na ang mga nagsagot? Madami na bang sumagot? Bakit ang onte? Sila Renmar lang ang estudyante ko. Okay na. Hypotonic, hypotonic, hypotonic. Tumayo lang ako tapos uminom ng tubig. Kaya ako nagtanong. Okay. So, if si Jomel is may hereditary spherocytosis, ang tamang sagot is dito sa side na to. Okay? Magkakaroon ng start mag-lyse yung ano niya. Magsa-start ng lysis dito. Okay? Sino naman ang mga cases na mayroong increased increased hypertonic solution, increased tonicity? Or gets sliced with increasing tonicity? When I say increasing tonicity, that means that we're increasing the value. Okay? Sino sa tingin nyo? Patients with MM. Ano yung mga MM na yan? Microcytic, MH pala. Microcytic hypo. Dito pala, sorry, mali. Mali. Alisin natin. Dito yan. Microcytic hypochromic anemia. Like what? Yung mga pinag-usapan natin kanina, sideroblastic, patients with lead poisoning, di ba? Thalassemia, sickle cell disease, include na din natin. Oh, the reason why we didn't include in the discussion sickle cell disease earlier is because we already had a discussion about it, but it falls under microcytic hypochromic anemias also, just for your information, okay? Under siya ng ano. So yun lang. So clear kung bakit hypertonic, kasi mas madaming water. Kung saan mas maraming water, mas doon papasok ang ang salt solutions, 'di ba? Kung mas madami ang water since hypotonic ang solution mo, mas madami ang water kaysa sa salt. So, ang water na 'yon papasok doon sa loob ng RBC. Kasi nga kasi mayroong problema yung RBC na 'yon, 'di ba? And mas mataas yung fragility niya compared sa other conditions we talked about. Clear? Clear ba? Clear? Kailangan nating Englishin, Renmar. Okay, stop na ako ng ano, stop na ako ng presentation. Nasaan na si ano? Si aking lovely ano. Okay. Wonderful. Okay. Ayan. I stop broadcasting na. All right. Now, now. We'll come back to what was that question again? Forgot na, nakalimutan ko na din. Oh yeah. Um, what was that question again? Oh my god. Don't forget that it's gold standard, by the way. Did I mention gold standard? So everybody's correct. Clap to everybody. I forgot to congratulate you guys on your effort in answering questions. Okay? Active ang mga students today. Sana medyo mawala ang init ng ulo ni Sir Marco. Okay? Dahil dyan. Okay? Alright? So, so. Oh yeah, what was that question? Defibrinized blood ang important na sample na kailangan natin gamitin. How do we defibrinize blood samples, by the way? That's another question. How do we defibrinize blood samples? Sige nga. Simple question. Sometimes med lab students forget. I'm gonna ask somebody random. May sakit si Dexter kaya hindi masyadong masagutin si Dexter ngayon. Kaya sige, pagbibigyan kita for today, pero sa next na meeting natin, Dexter, ha. Ikaw ang ano ko. Ikaw ang si Lil Zo. Hindi ko naririnig. Huwag ka mag-inarte Lil Zo na may sakit ka rin, ha. You have to participate even if you have malaria. Okay? Charig lang. Nasa na si Lil Zo? Okay, how do we defibrinize blood ba? Sige, sino yung nagtaas ng kamay? James Paul. So, okay, James Paul. How do you defibrinize blood? Hindi ko narinig. Magpapaklat ka lang ng dugo. Very good. Nag-intern ka na ba, James Paul? Yes. Okay. So one of the things that you do is as simple as letting the blood clot. That's the simplest way for you guys to remember it. It's let the blood clot. Okay? Why? What's the difference between serum and plasma? Serum is from the name itself. From the name itself, it's used for serology, and in serology we don't use plasma that much, right? For plasma, there's still what? There's still fibrin in them, in these samples, right? The clotting factors hasn't been activated yet, and it can cause a lot of errors or erroneous results in clinical chemistry and serological results. Okay? So, we use defibrinized heparin blood. Okay? Ayan. Hindi ko na alam yung next na next topic. So, I need Moyo's help. Okay, so can we see the next slide? If you're correct, heparinized evacuated tubes. Ang arte, evacuated tubes pa. Pwede din naman yung red top. Okay? Tapos paano kayo magsali ng dugo? Kayo, gumagamit ba rin ba ng vacutainer dyan sa Pilipinas? Kasi sa amin, parang gold na gold ang vacutainer nung time ko Vacutainer na ba ang common or syringe method pa rin tayo? Yung mga interns, I would like to ask. James, sige. Syringe pa rin kayo sa AFP? Diyos ko, parang gusto ko talaga mag-donate ng slides at saka ng syringe sa AFP. Diyos ko. Ganon. Mahirap talaga ang buhay na, class. Nasaan ang budget ng Department of Health? Nakakaloka ha. Anyways, let's move on, class. Okay? So, reagent that we use for OFT, I asked you that question already. It's 0.5%. Sorry, it's not 0.85%. Oh my god, I made a mistake earlier. 0.5% is the normal saline solution. We're using 0.85% diluted. Sorry, I made a mistake. Oh my gosh. I can't believe I did that. All right. So, hypotonic solution that you're going to test you're using NSS but you dilute it to 0.8 to 0.5%. That's what I meant earlier. Okay, so I made a mistake with that one. I told you guys I am an imperfect person with a perfect smile. Okay, so huwag nyo kakalimutan. Sometimes nagkakamali si Sir Manuel because there's a lot of data to be remembered. Okay, so 0.5% lang pala ng ano. But we still, to make your lives easier, we use normal saline. Okay, or normal saline solution and dilute it to 2.85%. Kasi yun yung mas madaling percent. Nasa isip ko kasi nung intern pa ako, pinakuha ko ng NSS, tapos dinagdagan ko lang ng distilled. Yun yung reason kung bakit 85 yung sinabi ko. Anyways, let's move on to the next slide. Okay? RBCs from patients with hereditary spherocytosis will easily lyse in hypotonic solutions. That's the answer. That's the answer to our question again. Just remember, if you forgot the reason why cells lyse in hypotonic solutions, just remember water goes in where salt concentration salt goes to where water is abundant. Okay? So, yun yung matatandaan ninyo para hindi nyo makakalimutan. What cells can resist cell lysis in hypotonic solution? I mentioned that one earlier. If you have sickle cell anemia or if you have codocytes, that is the correct answer. Let's move on with that one. Now, let's talk about macrocytic anemias. Macrocytic, how do we say how do we determine if a cell is macrocytic again? What RBC index are we talking about when we hear the word macrocytic? RBC index. An RBC index of this and that is considered macrocytic. What am I talking about? Class, you forgot already? Patrick. Pakitaan mo sila, Patrick. Okay. FL, ano yung FL, Patrick? Okay. Taray ng FL eh. Femtoliters. Ang arte ng femtoliters na yan. Alright. Thank you, Patrick. Alright. So, macrocytic. Okay, tama. Kita nyo kung bakit important yung maalala. Kasi you are going to see CBC results in your exam. Okay? And included in the CBC results is the RBC indices. Okay? So, do not forget the RBC indices. Okay? Alright, now, let's talk about the first one. This is vitamin deficiency, which vitamin B12 deficiency and folate deficiency. Both of them are involved in the same pathway. We're going to go there in a little bit. Let's talk about first the autoimmune form of vitamin B12 deficiency. So the autoimmune form of vitamin B12 deficiency is known as pernicious anemia, and it is caused by antiparietal cell antibodies. Okay? Antiparietal cell antibodies. Okay? It's pernicious anemia, and it's caused by antiparietal cell antibodies. Okay? Now, in terms of physiology, I think that's the next thing, right? Okay, in terms of physiology, what is the main difference between pernicious anemia and folate deficiency anemia? Pernicious anemia is more on autoimmunity, whilst folate deficiency is a dietary problem. Okay? Dietary problem. We'll find out later why folate deficiency is going to cause macrocytic anemia. Okay? Let's move on to the next one. Describe vitamin B12 metabolism. So, what is the other name for vitamin B12 before we come back? Vitamins or trace elements are discussed in Clinical Chemistry 3, if I'm not mistaken. We're not going to talk about everything about vitamins. I just need to know if you guys still remember what is the other name of vitamin B12. Vitamin B12 is what, Renmar? Alright, or to be complete, cyanocobalamin. Thank you so much. Alright, now, vitamin B12. Let's see the chart here. Vitamin B12 that is floating in your gastrointestinal tract goes in your digestive tract, right? Now, in the stomach, it will bind to intrinsic factor. Okay? In the stomach, it will bind to intrinsic factor. And it will form a complex known as IFB12. Okay? IFB12 will have two pathways. It will have two pathways. It will be absorbed in the general circulation and be responsible for DNA synthesis. Okay, it will be absorbed in the circulation and it will be used for DNA synthesis. The other pathway where it will go is the methyl pathway. It will bind to methyl to release methyl folate. It will be released. It will bind to methyl released by dietary folate. Okay, and it will become methylcobalamin. Methylcobalamin will then be reacted by what? An enzyme. I'm not going to go with the longest ones, but I just need you to remember homocysteine will then become methionine. I just need you to remember the last two in the second pathway. Okay? So, with that in mind, you need to remember that the end products of vitamin B12 metabolism from digestive tract to circulation is as follows. It becomes either for nucleic acid synthesis or DNA synthesis, or it goes the other way around where it becomes methionine or homocysteine. Okay? That's all you need to remember. Now, let's go to the next slide. What is the important blood chemistry finding of patients with vitamin B12 deficiency? You need to remember MMA, hindi siya mixed martial arts ha. MMA is methyl malonic acid and homocysteine. Okay? Methyl malonic acid is the circulatory form of what? Methionine. Okay? Homocysteine and MMA. Right? You'll find this with homocystinuria. In patients with homocystinuria, analysis of urine and bodily fluids. Okay? Or AUBF. That is also another thing that you need to remember. Now, MMA is what? When MMA, I think MMA is important, especially in patients for people who will be studying in or who will be going to medical school. They might remember MMA, methylmalonic acid, because it is, if you're interested in neuropsychiatry, it will cause neuropsychiatric disorders. Yun yung bigla na lang nagbago ang pag-ugali, or there's something strange in the neighborhood. Yun ang tawag ko doon. Okay? Okay? So, increased MMA can cause neuropsychiatric symptoms. Yung, for example, chill na chill lang si Renmar, tapos biglang naging very active na siya, tapos biglang nagwawala na siya, nananakit na siya ng tao, ganon. Alright? Diba? Or si Mel, yung quiet na quiet siya ngayon, biglang maingay na si Mel ngayon, diba? Bigla na lang kukuha ng kutsilyo si Mel, tapos bigla sinaksak sa liig si James Paul at saka si Patrick sa school. Ganon yung neuropsychiatric symptoms. Behavioral changes, kumbaga. Hindi mo naman normal na aktibidades, 'di ba, Mel, yung manaksak ng tao, 'di ba? So, yon. So, pwedeng i-test yung MMA mo, Mel, kung ganun ang mangyayari. Alright? Now, MMA is high in patients with... Let's go with the next slide. Masyado akong advanced mag-isip. Okay, so differential diagnosis, we go with B12 deficiency and folate deficiency. We can differentiate them based on the levels of MMA. It's normal with patients with dietary need for folate, while it is high with patients with vitamin B12 deficiency. Okay, clear? All right. Now, test used to determine the vitamin B12 absorption. Traditional test, we use Schilling's test. Okay, not to be confused with Schilling's method. Okay, Schilling's test is a different test. Okay, Schilling's test is when a patient is given a radioactive dose of B12, and after 24 hours, we measure the urine and blood for radioactivity to determine if there is the B12 is absorbed by the human body. Okay? So, if you have a patient with pernicious anemia, ano sa tingin niyo magiging result ng sample natin? Obviously, there will be radioactivity in the urine because it was not absorbed in the body. Okay? Because it didn't bind to what? It didn't bind to intrinsic factor. 'Di ba? Yun yung pinoprove ni Schilling's test. Okay? Clear? Clear ba? Medyo mabilis ba? Kasi tinatapos ko na kasi nagugutom na ako, class. Tinatapos ko na ako, medyo mabilis. If you have questions, please write it down and ask it later when I reintroduce I reintroduce the next topic. Okay? Now, we have to talk about megaloblastic anemias, of course. I think it warrants a discussion with megaloblastic anemia. Megaloblastic anemia is different from non-megaloblastic macrocytic anemias because of what? One thing that you need to look at is the hypersegmentation of the neutrophils. How many lobes are there ba in the neutrophil, in a normal neutrophil? Sige nga, balik tayo dun sa pinakaano natin. When would you consider it to have normal lobes? Normal amount of lobes ba? And when would you consider it as hypersegmented? Sige nga, Andrea. Andrea Nicole. Tama yung tinawag ko, Jinx. Tama yung tinawag ko. Okay, very good. Very good, very good. So megaloblastic anemia is having macrocytic hypochromic anemia with the addition of megaloblastosis. Ano ba yung megaloblastosis na yan, sir? Yung hypersegmented neutrophil lang yan. Huwag kayong malito, ha? Yun lang din yun. Okay? And non-megaloblastic anemia is macrocytosis without hypersegmented neutrophils. Okay? So clear? Clear tayo? Okay? Now, there are several causes of non-megaloblastic macrocytic anemias, and there are three things that you need to consider: alcoholism, drugs, and liver disease. Lipids to liver disease. Okay, patients. I think that's the next question. Let's see. Yeah, there we go. Patients with non-megaloblastic macrocytic anemia rarely experience classic signs of anemia. Is that true? True ba tayo? True or false? Sige nga. True. Hoy, nagmamadali ang aking nagugutom na din. Anong oras naman dyan sa Pilipinas? Nagmamadali siya. Magtatanong pa sana ako, pero sige na nga. Pagbigyan natin siya, medyo gutom na siya. Sige. Anong oras na dyan sa Pilipinas, Mel? Ay, 12 o'clock natin tapusin. 12 o'clock tayo, class, ha? Sakto tayo sa time natin. Alright? So, true siya because patients with macrocytes, unless it's a severe case, rarely experience anemia. Because there's a large surface area. Okay? They rarely experience anemia. Ano ba yung ano ba yung classic signs of anemia? Nausea, fatigue, 'di ba? Yung classic signs of anemia, yung mga ganun. And we're not gonna go there because that's internal medicine and I'm not a doctor. Okay, I'm just a poor medical technologist working my way to become a world-renowned drug superstar. Charit! Charit! Okay, charit. Okay, let's move on to the next question. Sige na mo kayo, next question. What is the common finding in a bone marrow of patient, in the bone marrow erythrocytic precursor of patients with non-megaloblastic macrocytosis? Well, you'll see a lot of vacuoles in them. You'll see a lot of vacuoles in the erythrocytic precursors. Okay? Bakit maraming vacuoles? Kasi kasi nga meron siyang merong incomplete substances na and it compensate, and vacuoles are basically a compensatory mechanism. Vacuolation is a compensatory mechanism. Okay? Next, move on to aplastic anemia. So aplastic anemia is actually a misnomer. A lot of the diseases that you're going to hear in the subsequent slides about aplastic anemia is actually pancytopenia. It's supposed to be pancytopenic anemia. Okay? But we refer to it, it's been, nobody has changed it and nobody wants to change it in the medical field. So we just refer it to as aplastic anemia. Okay, it's not really anemia. It's aplastic pancytopenia dapat. Okay? But we still study it as aplastic anemia. So there are three classifications of, let's see the next slide. I think that's it. Yeah. So there are three classifications of aplastic anemia. It could be congenital, it could be acquired, or it could be iatrogenic. Ang arte naman ng iatrogenic, can you discuss to me what is iatrogenic? Sige nga. What is iatrogenic? Ang arte naman kasi, bakit naman ganun, sir? Ano yung iatrogenic? Sige, who knows what's the meaning of iatrogenic? Alright, Renmar, sige. Walang pinanggalingan. Grabe naman yung walang pinanggalingan. Okay. So, iatrogenic is what? Okay. Who else raised their hand? Nobody? Okay. So Renmar is kind of correct, kind of not. Okay. Iatrogenic is Layla. Ano ba yan? Aksidente lang ba yon? Kasi nag-uunat siya eh. Is that an accident, Layla? O sige, go, try. That is a form of acquired, right? Iatrogenic. Iatrogenic, anyone? Use your Google powers, people. Because, girl, we are hungry. Girl, we hungry. Use your Google powers, people. Come on, iatrogenic. What do we mean when we say that something is iatrogenic? It's what? Patrick. Taray ng Google. That's a very Google definition. I love it. Okay, very good. At least we are honest. Some people would say that, oh, child, I know that answer. No. Okay. Yeah, that's correct. That is correct. It is medically, it's a medically induced condition. So ano bang mga medical inducing? Yung, inino ka, binumbard ka ng, di ba sinabi ko sa inyo last time, you could be what? You could be bombarded. You could be, some of you, or some of us, maybe me in the future, could be bombarded with what? With the medically induced rays of what? Of radioactive rays, di ba? For treatment of for maybe probably bone marrow, right? Why do we need bone marrow to be how do you say it, empty na lang? Why would we need that? Because we want to avoid, remember transplantation medicine when we discussed it? We want reduced what? Rejection, 'di ba? When you kill off all the cells in the human body, when you kill off all the cells in the bone marrow, 'di ba? You risk producing precursor cells that can cause or that can detect foreignness. Remember? You forgot na? Oh my goodness, guys. That was I think 3 weeks ago. Medyo matagal-tagal na nga. No, medyo matagal-tagal na, Renmar, no? Kaya kinig tayo, Renmar. Kinig tayo. Okay? All right. Now, let's talk about them one by one. There are two congenital types of aplastic anemia. We have diamond black fan and Fanconi anemia. Okay, please don't forget these two names, because when my friend, not me, my friend took the ACP quite recently, 2021. Okay, 2021. There was a battery of tests that was asked of him. Okay, and we'll talk about that later, but let's move forward with the next question. The congenital form of aplastic anemia that is known as a pure red cell aplasia, or pure red cell, meaning there's only the red cells are the only ones that are reduced, is the diamond black fan anemia. Okay? Diamond black fan anemia. Okay? Only the red cell precursors are abnormal there. Okay? Now, aplastic anemia is a misnomer because it's not really an anemia. Okay? From the name itself, it's actually considered Fanconi pancytopenia. Okay? Because there's also a decrease in RBCs, there's a decrease in RBCs, WBCs, and platelets. Okay? So please don't forget that one. Okay? Next slide. I think that's the answer to what I just said earlier. All right. Okay. So the answer is that one. Okay? Now, let us summarize. I think there's a chart next. Oh, no, that's the chart. All right. Let's show them the chart also. Let us summarize the difference between the two. Diamond black fan is what? A congenital form of pure red cell aplasia, while Fanconi anemia is pancytopenic. meaning there's a decrease in all the red cells. On physical exam, there's nothing that you can see in Fanconi anemia because there's a lot of symptoms there. But for that diamond black fan, you can see tripharyngeal thumbs. Okay? What's tripharyngeal thumbs? That's not important to us, but we have to look at the labs because we are medtechs. Okay? We are medtechs. Okay? Labs that we need to look for is decreased RBC count or zero RBC count if it's a baby that died in utero. Okay? And retics. Because diamond black fan means that there's increased production of reticulocytosis. Actually, it's one of the rare cases where you see majority of the red cells circulating in the human body is retics. Okay? And in Fanconi anemia, since all blood cell counts are down, all you see is all blood cell count being low. Okay? Age of onset is at birth, and Fanconi anemia can be a malignancy that can be a DNA damage that does not result to life at all. That's why I left it blank. So what are the causes? Ribosomal synthesis diamond black fan, and for Fanconi anemia, it's the BRCA mutation or the BRCA2 mutation. Okay? Clear? If you see the word BRCA, that's actually one of the questions that my friend was asked. An abnormality with BRCA mutation results to what disease or what condition? Yun yung question sa kanya. Ang answer is BRCA. Pakilagyan na ng star yan para hindi ninyo makalimutan, class. Okay? Let's move on to the next one. Now, there are two types of acquired aplastic anemia. One is idiopathic and the other one is secondary aplastic anemia. So, secondary aplastic anemia can be caused by 5 things. Don't forget, there are only 5 things. I've looked at the literature several times now for the past few years that I've been teaching this class, and it's always been 5. It's what? Drugs, radiation, toxin, viruses, and immunological causes. There are only 5 things that can cause secondary aplastic anemia. Okay? Can we see? Advanced talaga ako mag-isip. Nagmamadali na din ako, no? Okay? So those are the 5 causes of secondary aplastic anemia. Okay? Radiation, drugs, toxin, viruses, and immunological causes. Okay? Antibiotic, that is the known cause of aplastic anemia. It's not going to be asked here. It might be asked in bacteriology. Who knows the answer? Nobody. Renmar. Taray ni Renmar. Pakitaan mo sila, Renmar. Ha? Very good. Chloramphenicol. Okay? Chloramphenicol. That's why we give chloramphenicol as the last line of defense. Actually, you would see a lot of organisms right now. Ray, yesterday. Actually, today I released a urine result of a patient's urine culture. All of it is resistant except for chloramphenicol. Okay. All right. So that's the reason why they put it at the last. They put it as a last resort. Okay? Because it can cause aplastic anemia. All right. Now, let's move on to the next one. Toxic chemicals that can cause aplastic anemia. It could be heavy metals like arsenic and gold, or it could be benzene, an organic compound. Okay? Kaya nga 'di ba pinalalayo tayo sa organic chemistry experiments natin. You need to wear your PPE, especially when you're handling benzene or benzene-based products. Okay? There are 4 viral infections also known to cause aplastic anemia to man. This parvovirus 19, B19, hepatitis B, HIV, and EBV. Okay? These are also the oncogene activators if you may be familiar with them. Okay? Virology review. Okay? Next slide. Immunologic mechanisms associated with aplastic anemia. So, T cell activation causes the cytokines to be released, which can be fatal to progenitor cells. Okay? So, there is also an autoimmune cause of there's also a problem with the immune system. If there's a cytokine storm, it can cause the destruction, or it can kill off the myeloid progenitor cells. And remember, CFAG and CFAE is required to produce erythroblast under the presence of erythropoietin. 'Di ba? Nakalimutan nyo na last week, hematopoiesis. Oh, 'di ba? Kalimutan na nila last week. Now, let's talk about aplastic anemia in pregnancy. Some pregnant patients can present as aplastic anemia. True or false? I'll answer the question kasi nagugutom na si sir. It is reversible because it is reversible. We have what we call gestational aplasia. Okay? Or gestational aplastic anemia or gestational aplasia. Okay? It is reversible once the baby is born, just like gestational diabetes. Okay? But there's no correlation between aplastic anemia and the baby from a mother born of aplastic anemia. Just so you know. Okay? Now, next slide. Which patients are at risk of developing iatrogenic aplastic anemia? Persons who are going to intensive chemotherapy. I forgot to mention also there. Please add that one as our update to this one. Okay? As an update, please don't forget about stem cell transplantation. Okay? Because you have to undergo what? Irradiation. Your bone marrow needs to be irradiated. Okay? Next. Nice to know. I think that's the next one. Nice to know. Aplastic anemia, specifically aplastic pancytopenia or the black fan type, the Fanconi type, is often confused with myelodysplastic syndrome because of what? Because of the bone marrow. And the only way to differentiate the two is that in aplastic anemia, you'll have a hypercellular bone marrow, while in myelodysplastic syndrome, the bone marrow is pancytopenic. Okay? Okay? Hindi yan Miriam Defensor Santiago, ha? It's myelodysplastic syndrome. Huwag kakalimutan. Mamaya natin pag-uusapan yung myelodysplastic syndrome na yan. Okay? Pancytopenia with hypercellular bone marrow. Kasi hindi makalabas. Okay? Sa aplastic anemia, may kayang lumabas. Pero, walang lalabas. Gets nyo kung bakit? Hypercellular marrow at hypocellular marrow. Okay? Aplastic anemia, wala talaga. Kasi walang lalabas. Sa myelodysplastic syndromes, nagsisiksikan. Kaya hindi makalabas. Gets? Clear? Okay? Next. Autoimmune. Malapit na guys. Konti na lang guys. Okay? Autoimmune hemolytic anemia. It can be caused by red blood cell destruction. It causes red blood cell destruction. These are the only things that you will see with a positive Coombs test. Okay? Wag kakalimutan itong mga to. Okay? What causes cell destruction in hemolytic anemia? Of course, it's RBC autoantibodies. Kaya nga, autoimmune hemolytic anemia. RBC autoantibodies. General lab findings of patients with autoimmune hemolytic anemia is a positive Coombs test, specifically direct Coombs test. Right? Oh, tama ba? Yun na ba yung sumunod na question? Okay. Magmamadali talaga ako, no? Alright. General findings, okay? Blood smear, also positive Coombs test. The blood smear usually has normocytic normochromic anemia, okay, and there is relief formation or agglutination of RBCs in the blood smear. And when we look at the reticulocyte, there is reticulocytosis or increased reticulocytes, and bilirubinemia or increased bilirubin. Okay, so when you hear the words reticulocytosis, bilirubinemia, okay, you understand that the case means there's an increase in this one. Because sometimes I add that to the cases. Okay? Don't forget that. Alright? Now, there are two types of immune hemolytic anemia. Please don't forget. The alloimmune, which is caused by alloantibodies. Pag sinabi nating allo, ano nga ibig sabihin? Allo. Same species but can have the same but may not. But some species have some or some others don't have. Like for example, male is type A. Renmar is B. I am type O. All of us have the potential to have offsprings if we became straight men. Charing lang. I know, all of us have the potential to have all types of blood groups because we belong in the same species, right? But if it is mistransfused, if one of our blood samples was mistransfused, say for example, Mel who is type B was transfused with Renmar's blood, which has anti-B, all right, which has anti-A, it will cause intravascular hemolysis. Okay, hence the term alloimmune. Okay, alloimmune antibodies. Now, the autoimmune ones are the ones that you develop on your own. Okay? Hence the term autoantibodies. Okay? So those are the two types. Alloimmune, caused by transfusion reactions, and autoimmune, which is autoantibody cellular destruction. Okay? Now, there are subtypes of the autoimmune hemolytic anemia types, and the most common one is the warm hemolytic anemia. There is what you call paroxysmal cold hemoglobinuria and cold hemagglutinins and warm hemagglutinins. Warm hemagglutinins is the most common cause, that which accounts for about 80 to 90%. Thank you for that one. Okay, and we move on to the next one. The differences between the three things that you need to remember are the differences between cold and warm autoimmune hemolytic anemia. You have to remember what class it is. You have to remember the primary causes, okay, and then the secondary effects. Primary cause affects what, and secondary causes. Okay, all right. So IgG is for the warm one, and cold one is for IgM, obviously, right? It affects primary cause affects children most of the time for warm autoantibodies, and the elderly for cold autoantibodies. Okay. Secondary causes of this one can be autoimmunity, malignancy, and medications and viruses in children from warm antibodies, for the warm autoantibodies. But for the cold ones, it's mostly infections. Okay? Can you give me an infection that can cause cold autoantibodies? Bacteriology review. Maybe ask in your serology also. Renmar. Yes, very good. Very good. Junakis talaga kita. Okay? Very good. Junakis talaga kita. Alright, Mycoplasma pneumoniae and Ureaplasma ureolyticum. Alright? Very good. Let's move on to the next one. Okay, what form of malignancies are typically associated with autoimmune hemolytic anemia? There are three types of malignancies. Don't forget Hodgkin's lymphoma, chronic lymphocytic leukemia, and ovarian tumors. I don't think they will ask this to you, but just in case, lagdag lang ng dagdag. Anyway, hindi naman ako ang magre-review niyan. Sabi nga nung nagturo sa akin dati. Let's move on to the next one. What autoimmune diseases are associated with warm autoimmune hemolytic anemia? There are two things. SLE, obviously, lagi naman SLE lang ang problema eh. If nanonood kayo ng Dr. House, lagi ang start ng differential diagnosis ni Dr. House, SLE lagi. Okay? Ulcerative gastritis, not gastritic, ulcerative gastritis. Yun yung question. My God, my stomach is absorbing is breaking down my parietal cells, charit, with hydrochloric acid because I'm hungry, girl. Let's move on to the next one. Medications that can cause warm autoimmune hemolytic anemia. Methyl-dopa for those patients with seizures, okay, or anxiety disorders. Infections that are linked to cold AHA, Mycoplasma pneumoniae, infectious mononucleosis, and chickenpox. Okay? Next slide. Ay, wala na. Next pa nga. Baka meron pa. Ay, meron pa. Sorry. The rarest form of autoimmune hemolytic anemia is paroxysmal cold hemoglobinuria. Another name for paroxysmal cold hemoglobinuria is the Donat-Landsteiner hemoglobinuria. Okay? Donat-Landsteiner hemoglobinuria. Why is it called paroxysm? You might ask. I think that's the next question, right? Why is it called paroxysmal? Because when it's cold, right? When it's cold, IgG binds and fixes complements. When it's warm, the hemolysis occurs. So it's funny because you don't experience the hemolysis until you become cold. Hence the term paroxysmal. There's paroxysms. There's certain conditions that must be met. Okay? So basically what happens is just IgG and complements fix when it's cold. But then when you reach a warm environment, that's when the hemolysis occurs or hemoglobinuria occurs. Okay? What infection is associated with PCH? PCH is associated with syphilis. Okay? There are two types of syphilis that you need to remember when we're talking about PCH. I think that is the next one. O, diba? Sunod-sunod lagi ang notes ko. Okay? The two things that you need to remember is congenital syphilis and tertiary syphilis. Okay? Tertiary syphilis. Next one. Clinical finding that is common in cold agglutinin disease is the Raynaud phenomenon. You'll see it in the next slide. I think I put a picture of that one. See how weird it is, right? So when you're cold, your hand looks like that. The moment you reach normal blood temperature again at 37 degrees Celsius, you'll see the second tula, the second row. You'll see in the second row the purplish, almost gangrenous looking blood, purplish gangrenous looking blood. That is known as Raynaud's phenomenon, and that's caused by patients with cold agglutinin disease. Okay, now let's talk about spherocytosis that is a subtype of AHA. There's one type of spherocytosis that causes water to enter the blood cells, and it's warm autoimmune hemolytic anemia. Okay, and I think that's it for anemias. I've given you all the necessary information that you may need for your exams. Hopefully you've absorbed them. And the next thing that we're going to talk about is peripheral blood examination. Okay? Because there's a lot of inclusion bodies that I've not shown you, guys, already. Okay? So with that in mind, we're going to have a break. Hopefully, is it okay if because I haven't eaten since I woke up today. Is it okay if I take a break of about an hour? Would you guys love that? Okay? It might be increased though. It might be increased kasi magluluto pa ako, 'di ba? Syempre enjoyin ko yung lasagna ko, 'di ba? All right. So, if I don't appear after the timer ends, I'll increase it again to update it. Just look at it and you'll see what time you need to come back to. Okay? Clear? Okay. I'll see you guys later. Moyo, can you check if our live